Hello, everyone. I guess we'll get started. I'd like to remind everyone that our meetings are web streamed and televised, and for those of you in attendance, if you could please ensure that your phones are on silent mode. We'll begin today with the Board of Health meeting, and then we'll go into the public hearings at 3 o'clock. I would ask everyone to keep their comments brief, as we've got a lot to get through today. Also, as a reminder that we don't entertain third-time speakers to a motion before us. I'm also happy to welcome Mayor Hewitt for a portion of the Board of Health meeting to participate as a non-voting member. With that, I'll call to order the Board of Health meeting. We're going to add an update from the Agricultural Advisory Board meeting, and as well have spoken with staff that they would like a change in the order. Shanker's going to give his update first. So if I could have a mover for that. Moved by Councillor Taylor, seconded by Councillor Rabbits. All those in favor? And that's carried. Any disclosures of pecuniary interest? Okay, seeing none, we have the meeting, or the minutes rather, of the July 7th meeting before us. Councillor Martin?
Thank you, Chair Chop. Under the changes to the agenda, I would also like to add a discussion surrounding the provincial mask mandate. Ms. Boutis said she would come and provide just a bit of a verbal update for the Board of Health and for the public as well.
Okay, that's no problem. But again, if we could try to, this happened in the past as well, so we would usually do that before we move for the motion for approving the agenda. So right now the agenda was just approved, mover and seconder. So, but we'll add that in that case. I'm sure that's amenable to all of council. And again, moving on now back to the minutes. So, any errors or omissions in the minutes? Seeing none, they will be declared as adopted. Shanker, if you wanted to begin with your presentation.
Okay, there we go. Thank you, Madam Chair, members of the Board of Health. Thank you for giving me an opportunity to speak today. So at the onset, I just wanted to share a few comments. The presentation today is data-rich, and anytime there's a data-rich presentation, we particularly have the data analyst review this just to make sure we have the correct representation of the data elements. Most of the data that you'll see is actually prepared by the province or other authorities. But the one thing I would like to share is that no one data element captures the story of COVID or any other disease or any other item in public health. And the second comment that I would make is that COVID is probably the most consequential disease that the Board of Health is probably going to have to manage during its term. It's clearly been the most consequential medical problem I've had to deal with. I lived through the HIV crisis, and I would say this is supplanted HIV in many ways in its effect on the community. The third comment I'd make is a broad one, which is that medicine and public health practice is about judgment and making the best clinical decisions based on the data that we have. In public health practice, one of the big distinctions is that when we have an individual patient, it's just about the patient, and we can do everything we can for them. In public health, we have 110,000 constituents to somehow try to effectuate the best positive public health plan. With that, is there a way we could dim the lights? Because this is an old, in medicine we learn from the history. This is a very old slide. The reason I put this here is this is one of the first investigations of how far respiratory droplets can spread. And there's a guy coughing there, time-lapse photography, and that's how far it can go. And so when we think of respiratory droplets, that's the key way that COVID-19 is transmitted. This is our experience up till today. And is there a way to eliminate this bottom thing here, whatever that is? No. Okay. If this is a graph. This is the number of COVID cases on a daily basis, and this is the rolling average. At the beginning of the pandemic, we were at, I can't see it from here, but it was 640. That's the peak. Today, we're at 732. So at least by looking at the rolling average of cases, we have more cases today than we did at the beginning of the pandemic.
Could I just get you to hang on a second? One of my challenges right now is, we've had, it's been a while since a Board of Health meeting, and I think that it's prudent for councillors to pay attention, everyone, to Shanker, and not be spending time on their telephones.
So this is Toronto. And if we look at the rolling average here, there was the peak earlier on in the year. There's the numbers right now. So in Toronto, we have more cases now reported than we did at the beginning of the pandemic. This is Mexico. And if we look at Mexico, they have, at the beginning of the pandemic, they had few cases and few deaths. Mexico now has lots of cases, and it has more than 2,000 deaths a day. And Mexico's numbers are modulated by the fact that they have low testing capacity. So if they had more testing capacity, my sense is that they'd have more cases as well. This is our health district, and I want to talk about our health district. First of all, a lot of data is available on our website, but in our health district, we have a relatively few number of cases in recent times. But overall, we have 493 cases, and we have 3 active cases in the health district. So then let's go to in adjacent districts. The thing I want to share with you is the trend. This is the 7-day average, and if you look here, the trend is increasing in the southwestern district, which is west of us. This is Brant County, which is north of our district. There's the 7-day trend, and it's increasing over there. The city of Hamilton, which is north of us, and the number of cases on the rolling average are increasing. So these aren't just individual sporadic one-day items, but the trend suggests it's increasing. This is Niagara. The number of cases as a 7-day average are increasing. So with that, what I would say is that when we look at signals, when we think of epidemiology, it's not one data element. It's really, what does the whole picture show us? And at least a signal would suggest, and throughout the province and in our adjacent districts, that there is a trend towards increasing cases of COVID-19. I put this in here because this is the United States, and our health district is very proximate to the United States, especially in the Haldimand County. And there is a substantial increase in the number of cases in New York. Now, recognizing this was Friday's data, but the Americans are also having lots of cases. So the bottom line is, I think that we are now in a period of time where we're going to see more and more cases. The next issue, I think, and this is something to think about as well, is what is the likelihood of dying from COVID if you get it? And if we look at the circle boxes there, this number is sort of what we expect. About 31% of those people who are over 80 who get COVID will ultimately succumb to it. We expect that, right? Because it's a disease that affects the elderly or causes the older people to suffer disproportionately. But I wanted you to look at the next box right here. If you're between 60 and 79, and most people would not consider 79 as necessarily an infirmed time in life. If you're over 79, if you're in that age group, it's 9.1%. And this I thought was striking, if you're 40 to 59, and I'm 54, there's a 1% chance of dying. So our strategy in the Public Health Service is to try to diminish the background cases, and hopefully that'll minimize the number of deaths. I'm presenting this slide today because one of the things that we have to think about in the trends of data throughout the provinces, and this is a complicated slide and I'm far away from it, but this peak here represents older people who had COVID as cases back in the early part of the pandemic. But the point of this slide is if you look, this is today, this part right here. And this is divided by age group, 20 to 30, 40 to 59, under 20, 60 to 74, over 74. All age groups are showing an increase in COVID-19. It's just not the very young, but it's really all age groups. This is a slide from the Ministry of Health. And I wanted to highlight a few things. And this is a deck from the projections of COVID-19. So the first and important thing is that COVID-19 affects the entire healthcare system. So if I could present that more granularly, we think of the intensive care unit. If people have COVID-19 and they get really sick, they go to the ICU. We saw that in this health district with the outbreak at the agricultural enterprise. But also, when COVID cases increase, it fills up the ICU and other hospital resources, and then we can't care for other groups of patients, including people with cancer, people who need elective surgery. The other point I really wanted to share is this point right here. During the pandemic, deaths related to opioids have increased. And I've been looking for data on this because a Board of Health member asked me the last time to comment on it. And this is what the province in its own document says, that the deaths have increased. I'll show you the slide and then I'll present maybe subjective data. This is a slide where they compare the number of opioid hospitalizations, ED visits, hospitalizations, and deaths, and this over a period of time. And as one can see here in 2019, the number of deaths was 1,509. 1,509. I'll put that in context. The number of car crash deaths in this province are probably, I think, 550, 600. So we think that the province seems to promulgate that advice. That is my subjective sense as well, that the pandemic has had an effect on other public health priorities. I asked Marlene to help me. So let me present the subjective data. I get a copy of the reports from the police service about opioid deaths, the vignettes. And one of the things that's become apparent to me is that many people who die of opioid deaths are people just like me. They live at home, they have a wife, they have kids, they're dying at home. But just up to this point, and this is an underestimate, that there have been 12 opioid-related deaths in the health district just up to this year. And that's probably an underestimate because that doesn't capture the full data set. So one of the things I think we have to think about is we have these increasing number of cases in the health district, and as we use resources to manage COVID-19, we're potentially not paying as much attention to other causes of morbidity and mortality in the health district. So COVID-19 has just not affected people who get COVID, but it's affected the broad community of people who might otherwise need services. So what do we do? You know, in medicine, you never say you can't do anything. There's lots we can do. It's just that the treatments that we offer aren't general medical treatments. They're not medicines, they're not surgeries, they're not vaccines. It's about the core public health message, which is to identify, test, self-isolate, and monitor adherence. That's the core suite of interventions that we can really try to effectuate. This goes along with maintaining social distancing, wear a mask when you can't stay 6 feet, 2 meters away from anybody else. So this is our strategy. What is the contact tracing process? I put this slide in here, but basically what it means is if someone is identified as a positive test, and in Ontario, every positive test goes to the health unit, comes to us directly, automatically from the lab. When we find a positive test, we find all the people who might be close contacts, people at risk. If they're not symptomatic, they get a test and they're monitored and they self-isolate for 14 days. If in fact that close contact is sick, then they get a test and we pursue their contacts as well. And this is all for this 14-day period. If I could convince all of you that one positive case One positive case means we have to trace people in their family, their coworkers, the people in athletic activities that might be associated with places of worship. So the burden of the work for managing COVID-19 is not only on the positive case. In some ways, that's the easy part. They're sick, they're self-isolating. It's all these people who might get sick and how to manage their self-isolation plan. It's just not talking to them once, it's talking to them on a number of occasions. It's about the education. And if I could share with you the data, I think the health district has done more than 10,000 phone calls. We can give you the exact number. I'm going to leave you with this slide because this slide has benefit to me as a public health official, but I think, and as Board of Health members, I think you'd find it interesting. But it also has something about civic participation, which is one of the cornerstones of everything we do in our culture. So this is the number of people, although we have a relatively few number of cases right now, this is the number of people today who are self-isolating. When I saw this number, I was struck by it when the data team sent this to me. There are 545 people in this health district currently in isolation on October 5th. These are people who are part of the battle against COVID-19 because they're the people who might be infected but have decided, or rarely do we have to order people to do things. These are people who have decided to self-isolate so they can prevent the transmission of COVID-19. So my message today is we've gone through this journey of 6-7 months of COVID-19. We've put in public health interventions, public health measures to decrease the spread. We see now that there are more cases in certain parts of the province. We see, looking at that data, the trend that in adjacent health districts that we see a trend moving upward. And then the question is, how do we continue to maintain the vigilance? This health district has experienced 493 cases, which is more per thousand than the vast majority of districts. I think it's 4 or 5 in the province. It's experienced 32 deaths, which is more than, on a per capita basis, than most of the districts in the province. But I do also think that as a plan moving forward, that we just need to manage this like every other challenge that we have in our culture. So with that, I'm going to perhaps hand it over to Marlene, who's going to follow with mine, or Madam Chair, however you feel is appropriate. I'm happy to wait and answer my questions after Marlene, or if you'd like me to answer now, I'm okay too.
Whichever suits you best. Shanker.
My feeling is that since our presentations are intertwined today, that I think it'd be better if Marlene spoke after, because it's about our plan to manage risk moving forward as a health district. Does that seem okay, Madam Chair? Yeah, okay. You want me to get up? Okay. Go ahead.
Through the chair, if it's okay, if as Marlene sets up, I can just make a couple of introductory comments to Marlene's presentation, just so the board knows. This is a significant report. It was brought to you by staff who understand the magnitude of the ask. Staff did meet with Haldeman staff on Friday to discuss the report, and staff, the three of us, did attend Haldeman Council today on this report. Mayor Hewitt has asked to join this to provide comments from their council directly, so you can provide any comment to them. And I did want to draw your attention, because of the significance of the report. There was a very timely editorial from the editorial board of the Globe today that talked about the preparedness of Canada in COVID. And I won't, I'd ask you to go and look at it, but I will just read two very poignant comments that they made. And the editorial was comparing Canada's response to America's response. One of the comments was, if Canada can mute CNN for a moment, the situation in our country is rather far from rosy. The second wave of the virus is not a surprise. The lack of preparation is. And I think the reason for this report coming here today is staff's response to try to be prepared for the second wave. The concluding comment from the editorial was, Mr. Trump's failure has been huge and spectacular, American-sized all the way. The failures of some governments here have been quintessentially Canadian, marked by good intentions, timid, and severely crippling mediocrity. What the editorial board was commenting on is what we've seen both in Quebec and in Toronto, where you have a situation where Toronto is no longer doing contact tracing. The nature of this report that staff has put together is to put together a managed approach to deal with the second wave so that we're not put into that situation. So with those opening comments, I'll turn it back over to Marlene. I'll walk through the presentation and the report.
Thank you, Mr. Burgess. Madam Chair and board members, as Dr. Nitsithuri has already shared, COVID-19 is an emerging disease that has affected everyone globally. There is no script or playbook. The health unit must be responsive to the fluctuating nature of the COVID-19. COVID-19 has been unprecedented and has required significant resources that were not part of the 2020 budget and has been responded to under emergency orders and powers. This report will provide the board with an update of the COVID response to date and the health unit's recommendations to continue to respond to COVID, to hire a COVID team and implement an electronic medical record to protect the community and some of the most vulnerable populations within our communities. The team recognizes the magnitude of this specific ask. The Haldimand Norfolk Health Unit provides provincially mandated services to approximately 110,000 residents in the counties of Haldimand and Norfolk with several vulnerable populations. A high proportion of these residents are over 65 years of age, Norfolk County having 22.5% and Haldimand County having 18.1%, a higher proportion than Ontario at 16.7%. This population group is considered highly vulnerable to illness and death. The county also welcomes approximately 4,000 migrant farm workers annually. These migrant farm, sorry, I need to move the slide deck, my apologies, board members. These migrant farm workers reside in about 600 bunkhouses on local farms. The living arrangements of the bunkhouses creates an environment that facilitates the rapid and sustained transmission of the virus to susceptible migrant farm workers. There are approximately 5,000 low German-speaking residents living within the jurisdiction as well. This population travels between Ontario and Mexico, and as you know, international travel is a high-risk activity for COVID-19 transmission. Haldimand Norfolk has 61 schools, 42 licensed daycares, many home licensed daycares, 18 long-term care and retirement homes, of which are all considered congregate setting and high risk for transmission and outbreaks. There is a regional committee with Ontario Health and the local health partners to help support these settings. Since March, the Haldimand Norfolk has had 2 significant outbreaks. As Dr. Nitsithuri has already pointed out, the prevalence of COVID in Haldimand Norfolk is 447 per 100,000, or 7%, which is higher than the provincial average of 354, or 5%. Since March 2002, the health unit's primary focus has been the response to COVID-19, working with both counties, EOCs, and system partners, and redeploying most of the public health staff, and additional county staff have been redeployed as well. The activities to manage COVID are listed there, but not limited to case and contact management of positive cases and persons under investigations, or what we refer to as PUIs. There was they've responded to COVID hotline calls and environmental health calls, which have been in the thousands. We've been booking COVID testing since March, and we've been working on the management of the migrant farm self-isolation plans and ensuring that their LIMA applications have been processed. We've been involved in enforcement of COVID orders and bylaw breaches, As we've already stated, 2 significant outbreaks. The one outbreak required 30 staff to be mobilized within 24 hours to respond to that outbreak, contain it within the farm enterprise. Still did have some positive cases in the community, but was contained to a limited number. This is a really busy slide, and I know it's in the report. But this graph does demonstrate the activities of the effects to manage COVID since March 2020. The yellow line at the bottom represents the number of cases over time, and it's hard to see on the graph there, but you can see that the numbers are quite low, or the trend line is quite low in comparison to the green line that illustrates all of the quantified activities that have been required to manage COVID-19. Though the positive case trends may indicate a low caseload, one can see that there are still significant and ongoing COVID-related activities, even at the lowest point of the green line, where cases were low and the activities were at the lowest during the pandemic. The Haldimand Norfolk Health Unit is mandated to follow up with contact tracing within 24 hours. This timely response is one of the key strategies of containment. This is another graph illustrating the FTEs that have been allocated to date for the pandemic response of COVID-19. At the peak of the pandemic, or within our health district or health jurisdiction, the health unit required approximately 93 FTEs in May and June while managing an outbreak, and a steady decline to 42 FTEs in August and September as the workload for COVID stabilized. The orange line is the budget for 2020 FTEs, and you can see at its peak the health unit exceeded the FTEs while only managing COVID, and as the province was mainly closed. So this is the required FTEs without providing mandatory programs as per statute of the HPPA. The province has made it clear that Board of Healths are expected to take necessary measures to respond to COVID-19 within their jurisdiction while maintaining public health programs and services. Haldimand Norfolk and the province anticipates a continued COVID-19 response for the next 18 to 24 months, including management of outbreaks. As we enter into the second wave, the modeling trends that Dr. Nesithuri has shared with you are anticipated to be worse than the first wave. Like all other programs and services in the county, the province and the health unit are working towards recovery plans to do mandated public health work that have mainly been put on hold, as evidenced by our performance indicators within the report. It is imperative that the health unit continues to address drivers of community health and not just COVID-19. As part of the recovery, the health unit is reopening the offices in Haldimand counties on November the 2nd. It's important to note the 2020 budget was approved prior to COVID. Resources and FTEs were not included to provide these services in the new functional unit that manages COVID-19. Since 2015, the health unit has been funded by a new funding model with little to no increase in base funding. Last year, you will recall, and that the health unit was advised of the provincial shift in cost sharing that would impact the funding and the services to the communities. The team reviewed the programs and provided options to the board. Non-mandatory programs were transitioned and several other programs were reduced. The health unit budget in 2020 was reduced by 11.2 FTEs. We started the year with that reduction. The Haldimand Norfolk Health Unit is not in a position to continue the response to COVID, ensure surge capacity, and resume mandatory programs with all the enhanced COVID protocols like everyone else, and the added requirements of the added bunkhouse inspections and flu vaccines that we will be required to do moving forward. The cost to manage the effects of COVID will remain, and the health unit is requesting that we approach the resources with an organized and structured approach that enables surge capacity. Today, the health unit is requesting the implementation of an electronic medical record and 30 FTEs for a COVID team that will manage the daily activities that are required. This request is in line with similar situation in other public health units within the province. I'd like to walk you, if you'll indulge me, through 2 other examples provincially. In Hamilton in July, they were, in a report to their Board of Health, they were utilizing 300 FTEs to manage COVID activities. And to reopen the province, or to reopen and restart the mandated programs, Hamilton increased their FTE to 92, an additional 92 FTEs. In Windsor, in July as well, amongst the significant outbreaks that we have all heard about on the farm enterprises, many resources and supports were required. The Board of Health approved over 25 permanent FTEs at that time, while being supported with all the public health staff and 6 additional health units. Subsequently after that, the province had reached out to the rest of the health units, as you are also aware of, to support the containment within the Windsor area. Public Health Ontario provided a field epidemiology, and the ministry assigned a temporary associate medical officer of health to Windsor containment efforts. Additionally, the emergency operating centers for the Ministry of the Solicitor General and the Emergency Operating Center of the Medical Officer of the Ministry of Health provided support and coordinating measures to support the egg farm sector during these significant outbreaks. So the question is, why 30? So this graph, which you've seen before with the addition of the green line that represents 30 FTEs, demonstrates that 42 FTEs are required at the minimum amount to resource the activities to manage COVID-19. That is without any outbreaks or increased clusters within the community. The health unit will continue to redeploy some staff from the mandatory programs to continue to support COVID-19 in the addition to the 30 that is being requested this afternoon. It is recognized that some programs will be limited and not all accountability indicators will be met into 2021. The implementation of an electronic medical record, or an EMR, will also enable several logistics and processes to be streamlined. The COVID team is a new functional unit that was, again, not part of the 2020 budget. The team will continue to deliver the services for the COVID-19 containment efforts in an organized and structured approach instead of the ad hoc approach, while the health unit staff shifts back to mandatory programs to support the province's continued effort to reopen and to stay open, and to reduce the economic impacts that COVID has brought to our society. This approach enables the health unit to have a trained team to mobilize at a moment's notice for surge capacity, as increased numbers and outbreaks will be managed by the public health team being redeployed to COVID efforts once again. Without the COVID team, the health unit will be unable to provide COVID activities and the mandatory programs. Ongoing efforts for containment, as already spoken to, will continue and will be required with some additional activities moving forward. Case and contact management of positive cases and persons under investigations, outbreak assessment and management of congregate settings and outbreaks within the community. We'll continue to respond to the many calls on the hotlines for COVID and the environmental team. The community immunization clinics will include influenza clinics. That has been another strategy that the province has announced for the supporting the containment of COVID-19. Additionally, we have planned and will plan for future large immunization clinics in the event that a COVID vaccine is made available to us. Additionally, as we move forward in a condensed time frame, although there are 600 bunkhouses in a regular season, moving forward with the required self-isolation and the 2-meter distancing that is applicable to all sectors across our province, we are anticipating an additional 300 bunkhouse inspections, which a total of 900, which must be inspected within a short order over the next few months. Last year, as you will recall, as we managed the pandemic, when it first arrived, we did not move forward with physical inspections. However, we have been advised by Service Ontario through farms that a LIMA application will require physical inspections of all bunkhouses for them to process the LIMA application for migrant workers to be able to travel to Canada. Additionally, there will be approximately 480 isolation plans that will need to be processed to enable the migrant farm workers to self-isolate during the 14-day isolation period. And again, enforcement of COVID-19 orders and bylaw breaches will continue to be completed by the team. So in September, Alderman Norfolk has had 11 positive cases requiring follow-up with 70 close contacts. With the reopening of the schools and daycares, the team has managed 914 PUIs and following up with 211 hotline calls. Additionally, we've supported one outbreak in a long-term care home and over 20 other congregate settings with ill residents and children. The bunkhouse inspections have restarted, and as I stated earlier, approximately 900 are expected to be inspected in the next few months as required for the LIMA applications. The EMR is the second ask of today. Most health units have an EMR. I'd venture to say that we may be the only health unit in Ontario that does not have an EMR. The lack of an EMR limits the ability to cohort staff in multiple locations and/or the ability to work from home, as many people have been working from home. So we have closed to date, we have closed the Haldimand County offices and relocated all of our staff to Simcoe to manage the team with the paper charts that are required to be available to the team to manage the outbreak, the COVID-19. This could expose the health unit staff to a potential outbreak and the inability to provide services, including responding to COVID in mandatory programs. Once implemented, the benefits will be immediate, and the long-term benefits will also be realized, as streamlined processes will yield efficiencies, improve communications, and enhance data management. So, what are the risks if we don't move forward with an organized COVID team? The Board of Health provides many services to our community, and you can see that they are listed in the next two slides. We provide school-aged immunization. We have started doing school-aged immunizations in August. Unfortunately, we're not able to do them in the school, so we have started doing them off-site to enable catch-up immunization clinics for our school-aged children. School-based sexual health support, infectious prevention and control lapse investigations, inspections, many as you can see there, outbreak management of other disease of public health significance, such as measles, oral health programs, healthy babies and children programs, maternal health and breastfeeding, vector-borne disease programs, tobacco vaping education and enforcement, comprehensive substance use strategies, harm reduction, strategic planning, and CQI. Not providing these services as the province reopens places the community at risk of illness and injury, as many programs will not be able to be restarted. The prolonged impacts of COVID-19 on society are still largely unknown. However, public health resources will be critical in the management of long-term impacts of COVID-19 on population health, such as substance use, mental health, and chronic disease. A few additional risks. The escalating financial costs of the pandemic will continue as the response to COVID must continue and as they require ongoing response. There is a risk to organizational reputation with non-compliance to the statutes of the HPPA, as the health unit will be unable to meet its obligations under the accountability agreements. There will be an adverse impact on staff health and well-being, will exacerbate, thus further diminishing our response capabilities moving forward. Finally, current containment efforts will remain inefficiently managed and delivered. Last but not least, funding. Like many other programs and sectors, the province has announced significant investment announcements over the last 6 to 7 months, including announcements to the public health. Some funding has been realized in one-time funding grants in the annual service plan budget and funding from the province. This report is currently in circulation for the board meeting in November. The province has funded one-time grants, including mitigation costs from the cost-sharing changes that were reduced in 2020. The case contact management software implementation that was mandated by the province, that was implemented over the summer, school health nurses, and pandemic pay. Extraordinary costs and forecasts have been submitted to the province for 2020, including costs for the EMR and the COVID team within this report. A detailed report will be brought forward to the Board of Health once those numbers and funding announcements and funding allocations are provided to the health unit. And with that, I'm open to questions. Thank you.
Thanks, Marlene. Questions from board members? Member Columbus.
Thank you, Madam Chair, and thank you, Marlene and Dr. Schenker, for your report. Just wondered, the tobacco program that we run, I think it's up around $300,000 to operate that program. Are we committed to spending that during the COVID, or can some of that money be siphoned off to handle an issue that's much greater and affects the whole population of 110,000 versus just those that desire to smoke?
Yep. So through the chair to Councillor Columbus, we have not been providing that program because our energies have been focused all on COVID, so they will continue to do that. Some work if we may continue in that. We need to recognize that the tobacco program is not limited to tobacco, but limited to vaping and the cannabis use as well. So I will advise, though, that at this point in time, we are not providing that service, and moving forward, it would likely be provided in a limited manner.
So the staff that was involved there, have they moved over to some other department? And are we spending those monies, or can we not spend those monies because they're provincial dollars? Or
Currently, the FTEs have all been redeployed to COVID or other activities within the health unit, and we are utilizing those funds to pay for COVID activities.
Okay, my next question, Madam Chair, is with respect to the migrant farm worker program. And you said there's 4,000. How many outbreaks were there actually on farms? I know the Scott Lynn one was the big one, but how many other outbreaks were realized within the agriculture sector?
There was a significant outbreak on the one enterprise, as we're all aware, and I believe we've done many outbreak assessments where we've had ill workers, where we followed up with them, and I don't know the number. I know it's limited. Do you know the number of positives?
We can always share the exact number. We can always share the exact number. I think there were more than 20 outbreak assessments among residents of agricultural workers. There were also assessments during both the self-isolation and the post-isolation period. There have also been cases of migrant farm workers being sick, and we've had to intervene. Years of medical training, and can't seem to get this to work. Does it work now, Madam Chair? So a couple of things to think of. We can get the exact number, but I think there are probably more than 20 outbreak assessments. And so an outbreak assessment is when there's somebody sick in a congregate setting, and the 20 relate to seasonal, the residences of seasonal agricultural workers. If somebody is sick, the health district gathers more information, and then that person is separated from the rest of the members of the bunkhouse, and they get a test, and typically only when the test demonstrates or the clinical features demonstrate that they're not at risk are they reintroduced. So I think there are about 20 of those that have been done. There have been sporadic cases where we've had to investigate people that are ill as well. the key thing that is not the number of outbreaks. We've had one of the largest outbreaks in the province. We had 200 people who were infected, who were migrant farm workers. We had 20 people who did not reside on the farm who became infected. In that outbreak, there were 18 people who went to the hospital, 12 people who were admitted to the hospital, 7 went to an intensive care unit, 2 were on a ventilator, and 1 died. That's the risk set that we're dealing with. So the fact that we have, and that guides our vigilance, which is that, and even today, we're dealing with sick workers at congregate settings. The other thing I'd like to share is we have 600 residents of agricultural workers. Now, that is the largest constituency or the largest contingent of congregate settings. We have 18 nursing homes and retirement homes. Some of the seasonal residences of agricultural workers are bigger than retirement homes. And so when we think of risk, that's always something that weighs on our mind. Sorry for being so long-winded, but I can ask the staff to get you the exact number of outbreak assessments, 32. So so I can get that, we can get that number to you, but Marlene has provided it as well.
And of those 20 farms, or 32, that had, were COVID suspicious, I guess, is the way you want to word it, how many actually had the COVID in the bunkhouse?
Yeah, so
These are questions that we are getting as counselors, and because of the 3-person per bunkhouse ruling, we're getting these kind of questions, so we
Well,
need these answers.
we had, first of all, the test is not perfect, right? The best management is actually to separate the ill person from the people in the bunkhouse. We have had, we had a case where someone was positive in the self-isolation period. That limited to the number of individuals in the self-isolation residence. If that person was put in a bunkhouse with 25 people, we would have another outbreak. So that's just one example. In our review of the Scotland farm, we have found examples of people who were sick in the self-isolation period. And thinking of individuals who travel from Mexico, as I had said in that slide, shown that slide, Mexico is now an endemic area for COVID-19. So I think that we have at least, at minimum, been able to stave off some outbreaks in people in the pre-isolation period. I think there are lots of learnings we'll get from we'll get a lot of learnings from that outbreak. We are doing our assessment now. We have some preliminary thoughts, and we hope that we can change that we don't have any more outbreaks. That's my hope, that we don't have any more outbreaks in this upcoming season.
Thank you, Doctor, and thank you, Madam Chair.
Member Taylor?
Thank you, Board Chair Chopin, through you. I know in the report here there's the risks of inability to hire section. I'm wondering what we're doing to make our job postings more competitive compared to those in the surrounding health units, because I can only assume we're not going to be the only ones looking to do a major expansion like this. So,
Through the mayor or through the board chair to Councillor Taylor, I think there's a few strategies that we're doing, and one of the challenges, as you can see from the report, is capacity. But we have already posted the positions, and hopefully it's understood by the board that it's not to be premature without having board approval, contingent on board approval. Part of the effort we did that for is that so we could start to capture and start shortlisting people and then hold off on interviews until we had board approval. The process takes about 6 to 8 weeks, assuming we have HR staff to support us in that. So we have posted them. We have started to shortlist, dependent on the policy decisions that are made by the Board of Health. We'll then move that along. So that's one strategy we've undertaken. We have posted on different websites and tried to recruit people. But you are absolutely accurate in your thoughts and comments that recruiting this talent will be challenging as we are competing we are competing not just with our local healthcare partners, but healthcare partners across the whole province. It will be an undertaking and it will be challenging. So the sooner we can start the recruitment, the better served hopefully we'll be moving forward.
Thank you.
Thank you, Board Chair Chop, and through you. My question is regarding the COVID deaths that we've experienced in our community. I've been telling many of my constituents that all of those 32 individuals that have passed away were community members. They all had their own story. They all had lives, and that, that cold statistic, this is an ongoing emergency, and we're still losing people in our community. My question is, I'm wondering when the first death had occurred. I know that we had our outbreaks occurring in March, and I'm curious as to how long thereafter we lost our first community member. Can we recall what month or generally when that occurred? Thank you for that, Doctor. And when you're responding, if you just lift that receiver up just a little bit past the grain of the wood there, we'll be able to hear you. So,
Do you want me to repeat that? I'm
yeah,
sorry.
if you could for
Yeah,
everyone,
so
please.
we can get you the exact date, but my recollection is the first recognized COVID-19 death in the health district was in April.
Okay, thank you. So keeping that in mind as we see our numbers increase, we could be looking at seeing some mortality within weeks or even months of an outbreak occurring. Would that be reasonable to assume?
Yeah, it is difficult to predict the future. The way that COVID-19 can affect an individual at a long-term care retirement home is the chain of transmission. So the chain of transmission from a person who works outside the facility or resides outside the facility and having that transmit to them. So one chain of transmission could be a young person in school to their mother, to their father, and their father who might work as a healthcare worker in a long-term care facility. So it's hard for us to know exactly what that would be. But one thing that we know is that the more the risk is in the community, the more background cases there are in the community, the more likely there is to be a breach into a long-term care facility and ultimately illness and death.
Thank you for that. My second question, if you'll indulge me, is more in terms of the cost, and perhaps this question could be expanded upon by our CAO. So I'm on table 2, page 8 of 22 of the report, just looking at those additional costs, and I believe the intention of this report is to try to get ahead of some of those additional costs. Had we had 30 FTEs in that role at that time, I imagine we would not be seeing perhaps the same amount of additional costs. And I was looking at the difference, and it's about $1,400,000 worth of additional costs assumed due to a lack of appropriate staffing. So I was hoping to have our CAO respond and maybe expand on that table too, and just explain to us how, if we were to approve this additional headcount, how that could potentially reduce the amount of additional cost should we have another outbreak occur.
Thank you. Through the chair to the board member. Just to be clear, some on the table, there is one line on the table that's unpaid overtime. It's $427,000, so that's not an actual cash expenditure that's there. But the intent is, if you look at what staff had done, and Ms. Miranda had some good charts up there as far as the total hours that were deployed for COVID. She had the one chart where, there's this constant staff complement of 80-ish staff, and then on certain occasions it rises up well above the 80 staff complement. So the intent is to bring the staff in advance of the requirements to deal with that. you know, the challenge with looking at, you know, what happened between March and September and going forward, there is an underlying fundamental change in it. In April and May, we were shut down. There was no other services being done. So we were able to move our staff to focus on one item. And, you know, there was members from the clerk's office that was doing bunkhouse checks, and there was staff, you know, we have aquatic staff into the long-term care home. We just, everything was closed, so we were able to redeploy staff. On the go forward, the province is open. I think there's reluctance to move back to kind of that closed down status. So we need to, our staff are otherwise deployed doing other things. You know, we didn't have to worry about restaurant inspections in May because none of the restaurants were open. But now they're open. Now we have to worry about that, and we have those resources. So the intent is to, yeah, there was dollars paid. You know, the ask is less than the dollars, but I just want to be clear that it is a bit of an apple and orange comparison because when we were going through this in the peak of the pandemic, you know, the province was essentially shut. There wasn't a lot of other activities. Now those other activities are there, so we're trying to add the staff. Ms. Miranda has a table in there that says if you look at kind of the August-September timeframe or July-August-September timeframe, the amount of staff tied up on COVID activities solely, and that's figure 2 of the table. If you look at that, and this was before school opened up, you know, you were around 42 staff being deployed just for COVID activities. So the request from the public health unit is to essentially bring in 30 staff, which is less than what is being used right now at a low point to manage COVID. Recognizing that there's still going to be a redeployment of about 12 or 13 staff to accomplish that. And then if you get into an unfortunate situation later in the year where you do have outbreaks, where we, you know, have to send 30 people to a farm or to a nursing home or to some other outbreak, we're still going to have to pull staff at that point in time. This doesn't mean that automatically we can get through any crisis going forward without redeploying staff. It will be to redeploy staff. So the cost is significant. If we went through the same thing that we went through at the beginning of the year, is it cheaper to do it this way? Yes, but we can't predict the future. And that's why when staff did a task-based analysis to come up with the 30, and it was based upon the low point of our activities, to then say, well, if at a low point we're at 42, how much staff do we really need to essentially manage COVID as if it was its own department going forward? Because in reality, you know, we've had more than 40 staff deployed to this purpose for the majority of the year. So, you know, I know I'm not exactly answering your question, Councillor, or board member, because I just want to be straight with the answer is that the cost that we incurred was, you know, during crisis mode, and it was at a time when other activities weren't going on. So we're trying to project into the future what we think we need while everything else is still going on and the province is open. So I hope I can answer it. If I missed anything, I'll let Ms. Miranda speak.
Through the board chair, I'd just like to emphasize that during this time, activities of regular public health work were not being done. So this cost was solely, for the most part, allocated to COVID activities.
Member Michelle.
Thank you, Madam Chair, and through you to Marlene. Marlene, in your report, you mentioned that our health unit may very well be the only health unit in Ontario that does not have the electronic medical records solution. And in the written staff report, it also suggests that it should have been in place quite some time ago. I'm curious if you could comment on why that has not taken place in the past.
Through the board chair to the member, I can definitely answer that question. On my arrival about 5 years ago, I was quite taken aback that we didn't have an electronic medical record, and we did do a business case and submit some funding applications to the ministry to help offset the cost of that. As I moved into my second and third year of tenure here, it became apparent through the expert panel in the Patients First Act that the province was looking at restructuring and regionalizing to some capacity. So the decision was made not to move forward for a couple of reasons. We didn't want to invest all of that money and resources into a system that would potentially not be utilized moving forward, depending on what the restructuring looked like. And also, the province at that time was considering a provincial platform, so we thought it best to wait for that provincial platform. Another year and a half or two, you'll all be well aware of the announcements last spring about modernization and cost sharing shifts. And once again, we were in a world of modernization, so the implementation to implement and the costs associated with that would not have been timely or prudent of the health unit to move forward. Unfortunately, those decisions based on the provincial activities and modernization efforts has put us in the predicament we are today with not being enabled to move forward with work in an electronic medical record.
Thank you, Marlene. Thank you, Madam Chair.
Thank you, and through you, just going back to my previous question there with the job postings, I also meant to ask, how long ago were they posted? Just see how far along we are in this 6 to 8 week process.
So through the board chair, a couple of weeks at most, and we had to go through the regular HR process. So they've been staggered and posted over the last couple of weeks. There's still some outstanding postings that haven't gone up at this point in time.
Okay, thank you. And then one other question here. I know at the start of the pandemic there was a mad dash for ventilator capacity, and I'm just wondering where we sit as a health unit with our ventilator capacity.
Our colleagues at Battlefield are assembling the synthetic bagging device. I'll follow up with them where they are in the construction of that, but they have the parts and they're in the assembly assembly process. I think the hospital we can ask the hospital to comment on their current ICU and ventilator capacity. I think there's one other challenge. Is not only do you need ventilators in Haldimand and Norfolk County, but you also need ventilators across the province if there's a surge in ventilator demand. Reading some of the provincial documents, they would say that after you get above 150, I think that was the number that was quoted, that after 150 people who are on ventilators related to COVID, it might crowd out other programs and services. I'm happy to investigate that further and maybe perhaps get back to you on that.
Please, thank you.
Shanker, maybe you just want to comment, though. Again, those ventilators, I think there's always this misconception that they're the same as the ventilator that you would have in a hospital. It's not the same. It's really in an emergency situation only that you would be resorting to those synthetic bagging devices.
That's right. Those are, it's a wonderful contribution that Battlefield has done to have those devices, but they are they're not a perfect substitute for a regular commercial grade ventilator. In a pinch, if one did not have any other resource, it would be definitely a good choice, but they are not standard ventilators for sure.
Thank you, Madam Chair. To our medical officer of health, you said your presentation was heavy on data, so I have a few questions about the data. We had a peak in May across the province at 640 cases a day, and the latest stats, I think this week they broke 700 one time. But in May, that was based on between 5,000 and 6,000 tests a day were being done, and everybody was scrambling out of fear to get tested, no matter if they had symptoms or not. And we had 640 out of 6,000 tests. Now we have 700 with very strict guidelines on who gets tested out of 41,000 tests per day being done. So is there really a spike, or is it, like based on that, you'd say it's not really spiking, it's just that we're doing more tests?
Yeah, I think it's easier for me, for sure. So I have to apologize to the Board of Health that I don't know how to use a microphone. The question that you ask is a very penetrating scientific question, which is, we know that in general in epidemiology, that the number of positive tests is a function in some way of the number of people who get a test. So if you have 0 people being tested, then you'll have 0 people with a positive test, right? That's the most extreme example. And we do know that more people are being tested now than before. The question, though, is before, way back when, is what percentage of the people in the population who had COVID were actually being tested? And we don't really know that prevalence number. So I would use the number of cases as one signal that we may be on the way to having more cases. There are other things, and unfortunately, it's like risk-benefit assessment. I would look for the number of people being admitted to the hospital, the number of people going to an ICU bed. Those are all signals that one can use to make a risk assessment or risk determination. I think that there are enough signals to say that things are going to get worse. How much worse? We don't, that is something that we have to make our best judgment on. The other thing in informing us on this question is, has the disease management changed since it began? So if we think of HIV, HIV has drugs. So even if we had more cases, we would have more treatments. In COVID, nothing has really changed as far as the medical treatment per se. There's no drugs, there's no vaccine. It's mostly supportive treatment. The other thing to think of this from a field epidemiology, I could talk about this forever, so you can tell me to be quiet, is that from a field epidemiology point of view, you try one thing and see what the effect is. Regrettably, we've tried many things at the same time. But we've opened the schools, and is there an effect? I think we're seeing an effect. We open the schools. We know that COVID is a human-to-human challenge, where people, the more interactions, the more likely to have COVID spread. So we've opened the schools. We have more children in schools. We have more children that appear to have respiratory infections, and now we're seeing more cases. So is that a relationship? We've caused relaxations in restaurants and bars, and are we seeing more cases as a result of that? It's that, like everything else in medicine, you make the best decisions you can based on the data. But when I look at the data overall, I think we are on a trajectory for more increasing cases. And if that is the case, it's better to know about it in advance than when you can't, at some point, it's too far gone. So so in a long-winded way, I agree with you. That's the science, and we have equipoise. Every time I look at data, I have equipoise. We look at it critically. One of the things I always look at is this really true? Do we count wrong? But I think we have to, at the end of the day, we just have to make the best decisions that we can based on the data that's presented to us, recognizing what the risk could be.
If I could, Madam Chair, to follow up on looking at data, you mentioned the province has decided there's a spike in opioid deaths due to COVID, but the chart you showed up there, the graph, there's been a spike since 2015, and it's a pretty steady increase in 16, 17, 18, 19, but in 19, all of a sudden that increase is due to COVID rather than any other reason. What was the cause in 18, 17, 16, and 15? It's that same interpretation of data. I don't think anybody gets regular flu this year because they only get COVID flu this year. So again, that skews the data somewhat. And, we got to look at the whole thing. Being prepared is part of that based on the best information, but everybody can interpret the same facts and figures in different ways to see whether it's a good thing or a bad thing or a mediocre thing. So you're the expert on that with your, that we could talk all day about.
I feel like I'm in graduate school here with Professor Van Passen. Those are excellent points. So I guess the first thing I'd say is I would never, if I had suggested that, that's not what I meant to suggest. I show that slide to show that we have a trend with COVID increasing, and I've not been able to find data that ties COVID to opioid use. But I saw that presentation in the province, and I wanted to get that out there because another board member, I think, had asked me to comment on it. As a subjective item, the more part of the reason people have opioid use and opioid deaths is some level of disengagement. I think that's one factor. Mental health is another factor. And so I would surmise as a clinician that the more isolated you are, the more likely you are to be isolated from others, the more likely you are to have opioid use and opioid death. That's where I would say. Is the data robust? First of all, that increase is not all because of COVID. In fact, that data is before COVID. That chart is before COVID, and I put that as a caveat. But do we think that that COVID might have other effects on our culture and the public health service? I think that's likely, and when the history of this is written, I think that will be a challenge, like children not being able to go to school, or going to school in alternate formats, or not getting the right instruction for them, or missing out on their senior year. I got a letter from a very articulate young person who was quite distressed about high school graduation being canceled. So I guess my core message would be that COVID has affected so many other activities unrelated to COVID. To your second point, and I think this is also, and I know we talk in the public health service, we have to think of trying to get on with our lives, notwithstanding COVID. Just like having cancer or having a heart attack or anything else. And as a population, we have to recognize what COVID has disrupted our lives, which it has, but also, how can we move forward recognizing this might be around for another 18 months or 2 years, or, let's hope not, but to think of how do we move on with our life. So, Board of Health member, I think those are great points, and if in any way I misstated the data on opioids, that wasn't the plan, so.
Member Huffman.
Thank you, Chair. A quick question. Do we still have Norfolk County staff deployed to our long-term care facility?
So through the chair to Member Huffman, we have slowly redeployed them back to their respective departments. We still do have some that have been redeployed and remain at Norview. We also brought on some students to assist with the additional activities to screen and to support the residents at Norview.
Do you have a number as to how many are still redeployed?
Through the board chair, I'd have to confirm that, but more than 5, less than 10, I'm thinking there's probably about 10 still.
And my next question is, when you use the comparators of Hamilton and Windsor-Essex with the similar program, is their length of time the same as what you're suggesting in terms of the contract?
Through the chair to Member Huffman, actually the ones in Windsor were permanent FTEs. I'm not sure why, but that was what the report had spoken to and which was approved. My understanding in Hamilton from the report that was approved that it is temporary for the same length of time.
Columbus.
Madam Chair, I got 2 questions. First one is, are we expecting any funding from the Ontario government or the federal government to offset the cost of these 30-point-something persons?
So through the chair to member Columbus, I cannot see a world where all of the funding announcements have been announced and monies have been flowing in different sectors, that there wouldn't be some funding coming to Haldimand and Norfolk. As I said earlier, we have had some with our regular budget announcements for 2020 that you'll see in a couple of weeks at the next Board of Health meeting. And advisory members will see sooner. We have submitted, as I said earlier, we have had the opportunity to submit extraordinary costs, and we have done that. So we have submitted our cost to date for the COVID response, and we have forecasted till the end of the year, and we've submitted that, recognizing that the province has also said that there would be more funding opportunities into 2021.
Thank you. And lastly, I heard you made a presentation to Haldimand Council. What feedback have we got from Haldimand Council?
Mayor Hewitt is with us, so he'll be able to speak to that when we get to him. We'll take the rest of the questions. Member Martin.
Through you, Chair Chop, to staff, I have a couple just general COVID related questions and then a few concerning the report. My first question is building on Councillor or Board Member Van Passen's comments concerning testing sites. And I wondered if there were any comments you could share with us. We know that there will be a new testing site here in Norfolk County and another one closing. So with that said, I'm hearing a lot, and I don't have this confirmed or validated anywhere, but that there are additional testing sites opening. However, the same amount of laboratories to test the actual tests, and so therefore the results of the tests are delayed. Is this the case? Are we seeing a slowdown in the numbers coming back here in our area, or is this not true? Can you comment on that?
So through the board chair to member Martin, a couple of things have happened. So the Norfolk General Hospital has opened up their assessment center, which was opened up on Friday. Originally, they were intending to have walk-in appointments, and Hagersville has been doing by appointment and walk-in appointments. So with that being said, the province has now, over the weekend, again, provided some additional direction, and it's multi-pronged in that all testing must be by appointment, and there will no longer be walk-ins available. Asymptomatic tests, if you're asymptomatic, will be provided or need to be tested at a pharmacy. Unfortunately, a local pharmacy in Haldimand, Norfolk is not available. I believe the closest one is actually in Brantford. There is criteria of who can be tested at these assessment centers. So all of those things, there is a media release. I'm not sure if it's been released. It has been prepared, and I know our communications team, if hasn't released it today, will release that today, which articulates those things, but also articulates the 3 centers that are available and the times that they're open. So the 3, just for the board and the community at large, will be at Norfolk General Hospital, which is new. West Haldimand General will continue to provide an assessment center, and the Haldimand Hospital will also provide testing. The Delhi Family Health Team has been providing testing and assessments since March, and with some of these changes is unable to move forward with testing in our community and has shifted back to their primary focus of primary care. In answer to your lab results or the capacity of the labs, the province has increased testing capacity and lab capacity. I can't speak specifically to whether it's increased more in the last short while. I can advise you, though, that the results are taking longer. So they are about 2 to 7 days. Sometimes we get them within 24 hours, but they have been taking longer to get the results back. So I hope I've answered your questions. If I've missed anything, let me know.
That's great. Thank
If
you.
I could just jump in there to add one point, Marlene, maybe you could touch on for the Board of Health members. there's conflicting messages coming out of the province. We heard anybody can go get a test and so on, and now, as you mentioned, if you're asymptomatic, you can't do it at the hospital. That's not the Board of Health or the health unit that's making that decision. That's a provincially made decision, and we're testing according to their criteria that they've given us. Maybe you could also touch on the fact that, this idea that anyone at any time can get a test, that we're still limited by the number of tests that the province is providing to the hospital in Norfolk and as well in Hagersville.
Yeah, so I would like to clarify the asymptomatic, if I may. So your points are correct, member Chop. The asymptomatic testing is for those people, like if today I decide I want to go get tested for whatever and I'm not displaying any symptoms. However, if you're asymptomatic and under provincial directives, i.e. you're a caregiver of a family member in a long-term care and you need to be tested to enter the facility, you are still eligible to go and have the testing at the assessment center. So there is that caveat to the criteria. And yes, you are, as I understand it from working with Ontario Health and our respective assessment centers, there is a cap on testing that's been mandated by the province in each jurisdiction.
I just add that point because a lot of things that we see online as well, why don't we test all of the migrant workers? Why don't we test, all of so-and-so? And so there is a limit that's being imposed by the province on each health center as to how many tests per day that we're allowed to do.
My next question would be, could we get an update on the pop-up medical center that the health unit, has here in Norfolk County, and the type of resources and funding that's still being allocated to that, if at all? Could you provide us with a general update?
I'll start the comments, and if I may refer to Mr. Burgess to assist. So the pop-up hospital that was put forth at the beginning of the pandemic currently has been demobilized. The hospitals have a surge capacity plan and have additional beds that they have worked towards and will continue to work towards. However, we will, if required by the hospitals and the request is made, we are able to mobilize the center in fairly short order. I know we've tried to minimize or eliminate all of the ongoing costs associated with that. I don't know if Mr. Burgess can speak to some of the specific costs that may still be incurred, but if not, then I'm happy to just pull that from the team and provide it to the board.
Yeah, through the chair, when we demobilized, we picked up a shipping container. We moved the materials that we had bought into the shipping container, so the cost going forward is minimal. The initial capital outlay costs are still there, but any contracts that were there, we've unwound from the contracts at this point in time.
Okay, thank you. My next question, we talked about other municipalities, Hamilton, Windsor, evolving their health units and adding FTEs to their complement. Are you aware of any other municipalities that are similar in size to what our health unit serves, but would have more comparable geography? So when we look at Hamilton, they have about 600,000 people in the area, but they're in condensed living quarters and so on. Are there any health units that you're aware of that are more on par with our health unit?
So through the chair, most, if not all, of our health units are ramping up. So the reason I chose Hamilton and Windsor to provide a comparative was because they had written reports had gone to the board, so I could articulate that information. I know Halton, as an example, which is a larger center, has hired 25 nurses recently. I know all of my colleagues in the surrounding areas in Brant, Southwest, Chatham, Kent, Lambton have all up-staffed as well. I just didn't have the concrete numbers to share, and I didn't want to do that. I think Windsor is a good comparative, although they're significantly larger. Like us, they have the migrant farm population, and they have double the population of migrant farm workers. However, we are the largest per capita. So I think that is a good comparative because of the significant the numbers of migrant farm workers that we both welcome. Additionally, the Low German speaking communities across southwestern Ontario, there was some clusters that collectively the health units worked on together over the latter part of the summer. And Windsor is home to many of those Low German speaking community members as well. So there are some comparators, even though the populations are larger than Haldimand and Norfolk, and I can assure you that all health units have up-staffed. I just can't give you those concrete numbers.
Okay, thank you. A few more questions, Chair Chop. The status of our staff. Can we have an update on the status that we reallocated to help with the Windsor-Essex update? Are they complete working over there and back on duties here in the Haldimand Norfolk Health Unit?
So through the chair, that assistance was time limited. It was only for 2 or 3 weeks, and we only allocated a couple of nurses. We trained up a few just in the event that things should escalate. So we did actually only provide support for, I think, 2 or 3 weeks, and we have since redeployed them all back to Haldimand, Norfolk. And I just want to assure the board that no overtime was incurred to support Windsor in their efforts.
Thank you. Is the province making any statements regarding their provincially mandated programs and flexibility for health units to resume those programs or not resume those programs? Have they made any comments in that way?
So through the chair, it has been advised that we are to restart, like everyone else in the province, to implement and restart and restage up our mandatory programs. You can appreciate, and I know Mr. Burgess has already referenced this, as restaurants open in the rest of the provinces, there is a need to do those activities, and we can't not do them. We can't not respond to adverse waters. We can't not respond to rabies. We can't not ensure that our restaurants, our spas, etc., are safe. So those activities are required, and it is the Board of Health's responsibility to ensure that those programs are available to the community, not just COVID.
Should we be very, very lucky and the numbers don't progress and we find ourselves in an opportunity where we've taken on additional staff until June of 2022 and they're not needed, what would the plan be at that point in time?
Like any other program that's managed and budgets are managed, we'll continue to evaluate, redeploy staff accordingly. If tomorrow we get a vaccine and we're able to do mass immunizations or antivirals are made available, we will continue to assess and we will work through our collective agreements and terminate those contracts if need be. We've set that date for a couple of reasons. The province has already articulated that we anticipate that this would be 18 to 24 months, so it does align with other funding that has been made available, and from a recruitment effort to try to hire anyone, especially when the market is so stretched, for 3 or 6 months is challenging, so we like to bring them on. You have to appreciate that we're about 6 months behind in mandatory program, recognizing that it's not about catching all of them up, but it is about working towards achieving those mandated programs and maintaining the health and safety of our communities.
Okay, thank you. My final question is about the EMR. So this type of programming is going to help find efficiencies and put information online and allow staff to work from home. Will this program assist with the municipal business licensing that the clerk's office runs? And I ask that because when we held our open house meetings concerning those licenses, a part of the reason from the clerk's office as to why they did them was because there was a lot of overlap between the health unit, the information that they share, clerk's offices, and so on. So will this EMR help with efficiencies concerning the overlap in the services that clerks and the health unit are providing with regards to businesses like restaurants and spas?
If I could ask my colleagues to assist me in responding, I'm not really sure what the licensing for clerks, et cetera, entails, so I'm at a disadvantage to answer the question.
Through the chair to the member, I don't believe there would be efficiencies gained. The electronic record management system is a health patient record system. So the information that's for licensing is, past inspection reports and that kind of stuff. So I'm not fully the focus of this is to be able to provide patient records on a secure database that only a select number of people can access that have that clearance, or I'm not sure what you want to say, but it's to be able to manage patient records, not some of the records that are used for licensing purposes.
So if I may, I have heard from staff who are watching and are involved in the licensing, and they've confirmed that it would not support the licensing piece of it either.
Okay, thank you.
Mayor Hewitt, thanks for joining us. We can't hear you, though.
Can you hear me now?
Yep, now we can hear you.
You can hear? Good. So thanks for having me. I really appreciate it. I guess I just want to start out by saying that I'm here in support of the process. I'm here in support of staff. I have tremendous confidence in Shanker, tremendous confidence in Marlene and her team. That being said, however, because of what's being put in front of you and what's being asked, I think it's important that I bring the views of Haldeman and certainly share some thoughts. So the doctor made a comment earlier that with the data, we have to make the best decision that we can make, and I agree with him wholeheartedly, and I'm going to use that with respect to the numbers, because I think that over this past 6-7 months, we've all can agree that we've learned tremendous, we've experienced tremendous even more, and we'll continue to probably learn that much more. But that being said, we went through a process with the province, who was learning the same as we were on the fly. And a lot of the data that shows what happened 6-7 months ago can be attributed to the fact that it was our first experience. And I will suggest that when looking forward, that many of the occurrences that happened in the past likely will not happen the same way in the future. And I'm not to say that we'll have a second wave or that we'll have a potential migrant farmer breakout, or even a breakout in the long-term care. But I do believe that we've learned from those experiences, and with that, the outcomes could be, or will be, certainly different. And I think that needs to be taken into context. I also believe that the numbers do say a lot, and what's being put in front of us, albeit as significant in terms of dollars and cents and a percentage to our overall tax levy, we do have to take into account without deflating the issue that surrounds the fact that COVID is a dangerous disease and has caused a lot of harm to many families. It has affected 493 people in Haldeman, Norfolk, and that represents 0.4% of the population in both combined communities. So again, I don't want to downplay that, but that is the number. And of those 493, I believe, and Shanker couldn't confirm, but I believe it was 32 deaths. And of those 32 deaths, it's fair to say that there were underlying symptoms that were attributed to it as well. Not to diminish the COVID and to diminish why they passed on, but it is fair to say that there was other things that could have been related to that. I just get my notes here, if you bear with me. A question was asked earlier about the province and them being able to contribute to the possible funding of such programs. And albeit I know all the announcements aren't coming out, and it's fair to say that I think that with some pressure from ourselves, other municipalities, and certainly many cities who will be experiencing the same issues, I believe that there should be, or will be, possibly some funding that could come down to support some of these costs. However, we don't have that information in front of us to make that decision today. But as I say, we do have the experience that we have to rely on to curb or certainly change the outcomes, and also the calls and the bylaw related issues that did put a tremendous amount of pressure on the team. Not to say that it's not going to happen again, but I do believe that our experience will help us guide us through that a lot smoother. The problem I have with today is you're being put in front a report to ask for just over $5 million, and that ask is more than double the current budget for health and social services. There's no true numbers at this stage to be able to support the 32 FTEs, and I don't want to contradict Marlene's comments. Again, I believe she has the expertise and the ability to make that decision, but I don't see in this report enough to be able to substantiate those numbers and to be able to go to our tax base and say that this makes sense, that we should be spending on Haldeman's side approximately $1.4 million in 2021, when I can't stand behind the report and support our staff, but also support the Board of Health and its decision. So this morning we met. It was the report was deferred, and with that deferral, we've also asked that staff look at the possibility of downloading some of these costs. We believe that if our migrant workers, for instance, the inspection costs should be a cost that's directly associated with those farms, and we believe that those costs should be downloaded to the farms, and it should be based on a cost recovery basis. The reason for that is that I struggle with the idea of asking a business in downtown Simcoe who cuts hair or who's providing flowers, and asking them to pay taxes to support another private enterprise, such as the farming operations. If the farming operation does not get the funding from the province, which I believe they will, but should they not get it, then they'll simply download that cost onto those buying those fruits and vegetables. And from that perspective, it would be everyone across the province paying for it, not just simply those people living in Haldeman, Norfolk. So our perspective is that staff should be looking at a cost recovery program with respect to the inspections, and that they should defer the report. We don't double negative. We do support the idea that we need to move forward with bringing on some FTEs to help facilitate this process. We don't want to see Marlene's team diminished, and we want to see them supported. But we can't at this stage be able to support a $5 million program that's been walked on to this agenda without further evidence to support it. And I know that here in Haldeman, we will have a tremendous amount of pushback with respect to that. That's simply it's a 3% tax levy to our budget, just simply on that item alone. So I'm here to encourage you to take a look at the report seriously, to look with staff to find alternatives, to ask staff to find alternatives, to meet with Haldeman County staff, to allow us the opportunity, if need to be, reconvene in an emergency meeting to be able to bring the numbers forward and the budget forward so that Marlene and her team can move forward. We don't want to stand in their way, but at this stage today, we simply cannot support moving forward as it sits today. So we hope that you'll take that in consideration. And again, I thank you for your time.
Thank you, Mayor Hewitt. I'll read out your motion that was passed at the Haldeman Council meeting for our council here. If there's a correction, just let me know. It read that the Board of Health be advised that Haldeman County Council requests that consideration of report HSS 20-18 and its recommendations be deferred until Haldeman County staff receive an additional business case information requested from the health unit and be given sufficient time to review, collaborate, and to provide written comments on the report and supporting information to the Board of Health, and that additional costs related to migrant worker inspections be on a fee-for-service basis rather than from the tax base. Okay, further questions from board members? Member Michelli.
Thank you, Madam Chair. I'm just wondering if I can ask this question of the CAO. In the case of Norfolk County, what would be the tax levy increase?
Through the chair to the member, ballpark $1 million expenditure is a 1% levy increase. So if you look at for the 2021 year, you're looking at almost a 2% levy impact. For the remainder of 2020, in theory, it would be $600,000, which would be a 0.6% levy impact that we would have to fund from some source internally.
The total would be 2.6.
On an annual basis, it would be about 2%, yes.
Okay, understanding our neighbors and Haldeman's position related to this, does somebody wish to move the staff recommendation? Somebody wish to move for a deferral following Haldeman County until some additional information can come back and we can reconvene an emergency meeting if necessary? Member Rabbits.
Thank you. Through you, it's generated a question for me. We've had our comments back from our friends in Haldeman. The suggestions there aren't listed in the recommendation of this report. I was hoping before we can move to presenting either moving staff's recommendations or proposing an alternative, that we have an opportunity for staff just to comment on the cost recovery aspects, if that is something that can be borne by those that are suffering an outbreak. I think it makes more sense to entertain this idea when we're talking about a private enterprise. I believe there might be some complexities in trying to have a cost recovery from, say, a long-term care facility or something that is semi-public. So I was maybe hoping for maybe a response to some of the suggestions from Haldeman before I then suggest writing them into our recommendations, because I'm a little unclear if that's something that we're able to do. And so I just want to provide them an opportunity for some feedback before
If I could
we
just
go
jump in
forward
there,
too quick.
Member Rabbits, just maybe you didn't, perhaps I didn't read it clear enough. Haldeman's ask was just related to the inspections themselves, not to the outbreak management. So just going in and doing the bunkhouse inspections. So right now, as an example, currently we charge by the address, and it's a nominal fee. I think it's like $100, is it?
It's 101 currently.
$101 per address, so not by the bunkhouse. So if you're a farm and you have 5 bunkhouses to a single address, that's obviously 5 times the amount of time that it takes for another farmer that just has 1 bunkhouse on his address. Yet both farmers, the large farmer and the small farmer, are paying the same amount, which, clearly there's some inequity that's been, going on for years with this. So I think that could come later with the ag advisory update. I think the focus right now would be just to deal with this ask for, the additional staff and so on. And again, whether you wish to follow Haldeman's lead to defer the report to get some more information back.
I guess if I may, and I have a lot of inarticulate questions, I'm apologizing to the staff in advance for that. But isn't that something that we could entertain anyway with approving the 30 FTEs? I'd be surprised if that wasn't something that was being considered cost recovery for inspections.
Through the chair to the member, the bylaw specifically on the inspection cost was being reviewed and was going to come up through the budget process. As the mayor has outlined, the $100 is nowhere near cost recovery basis. I think there could be some other activities on top of just the pure inspection, anything related to the actual application of the program that's required. So this would be targeted for the temporary foreign worker programs where public health has to be involved in ensuring that they're eligible for for the program. So those costs associated with that would be the ones that we would look to capture cost recovery. Any other charges for services that any other resident would normally get as part of being a resident, that would be kind of off limits. It would be just the ones that, so if it's outbreak management or anything like that, that would be something that's just a public health cost that you'd have to deal with. So we would have to limit it very specifically to which costs we can charge and try to get a format to try to maximize the cost recovery from that to align with Haldeman's recommendation. So we could do it. It is part of the system. We would have to be able to bring a new bylaw to this council, so that would be effective for January 1st or earlier as the inspections happen.
Well, with that, and if I may, if it's in order, I would like to move staff's recommendation as written, and I would also like to add the following clause, and I'm going to try to wordsmith this as best I can. And the final clause would be, and further that the Board of Health report back with options for cost recovery for inspections and other services provided by the public health team. I think I got
you
that
want to
out
correct
there.
that a little, because you don't want the Board of Health isn't reporting back. You're going to report back with something, or you want staff to?
That staff report back to the Board of Health. Help me wordsmith this a little bit. That staff report back to the Board of Health with their recommendations to achieve cost recovery where applicable. Could have that read back to me one time, and I liked what Jason said, and I was trying to phrase that in one paragraph.
And further, that staff report back with options for cost recovery on inspections where applicable.
Unless staff have any objections to the feasibility of that clause?
Just through the chair, the member may consider which committee you want to report back to, because it is part of the rate, it's part of the user fee bylaw. You may want to, instead of reporting back to the health committee, you may choose to have it report back to CIC or council, because that would be the authority to set that fee. But that's up to it can go to the health committee and then move it through the process that way, or just directly to council.
My preference would be the most expeditious way for it to come back before the decision-making body.
I would put it to CIC then.
Member Van Passen.
Thank you, Madam Chair. Before you get a seconder for that, I have a couple of questions. I think there is like 3 distinct issues here, and since we still have the Mayor of Haldeman available, I'd like to maybe question the mover, after on his motion as presented. One issue is, do we hire some more staff immediately so that we don't burn out the current staff, so they're allowed to use some of their holidays, so that we're not paying overtime? I think the answer to that is yes, and that's one distinct issue. It's a matter of, do we get like 4 to 6, I think, somewhere in the report, if I remember correctly. That's just to get us back to 0. That's one question. Question number 2, do we go to the electronic medical record system and invest $400,000 into that programming? My logic tells me that if we don't get that in the report, it says we'd have to hire 4 more staff just to account for that electronic record. So if we do get it, that must save 4 other staff. So it should work both ways. So by investing in that bit of technology, it frees up 4 other staff in another area that can be used. And then the third question in these recommendations is, do we want to develop sort of a COVID-19 special SWAT team with 30 people with our own dollars? And, my answer to that question would be no, but can we make a deal with the province? Haldeman Norfolk Health Unit has experience with a serious outbreak at a long-term care facility. It has experience at a serious outbreak on a farm facility. We have that experience in the background checks and all of that. And if the province wants to fund us to train a special COVID SWAT team to follow up on those kind of instances where it's required, where it could be used anywhere in the province, where it needed. That to me is a separate entity all by itself. So, again, before the motion gets seconded, is it better to look at it as three separate and distinct things rather than just one big motion that maybe solves nothing in the short term and everything in the long term, and by then it's too late?
Sounds like the question was directed to myself, being the mover. I guess I'll address the first question. Do we hire more staff? I felt that the report did demonstrate a need for that. I think the answer is yes. For the electronic management of medical records, do we buy it? I believe that the answer is yes, and I do believe this report highlighted the fact that we are woefully behind our municipal comparators in the management of medical records. The third question there is, do we have our own dedicated COVID team, our own COVID-19 department consisting of 30-plus individuals? I think that the answer is also yes to those questions, and I believe that's going to be affected by staff's recommendations. So unless you could entertain dividing the question, I'm more than open to dividing them. I think they're mutually complementary in staff's recommendation. I think they flow well one into the other. But if we wanted to divide the question and tackle each of those questions separately, I would need to hear from the member what that recommendation is to vote on. I didn't hear any questioning of the third clause or that last clause that I had added about cost recovery. And I believe that speaks to a little bit of the concerns that we're hearing from Haldeman, that this is too much for the taxpayer to bear alone, and that there is an onus on those businesses that are in a higher risk of an outbreak or require more inspections and more staff time to bear some of those costs, which is why that was my intention of adding that last clause in. And I'm hoping that my colleagues around the table may have been writing their own amendments or their own thoughts on how we can mitigate the cost of the taxpayer, because this is quite a big ask. And I'm more than willing to work with any member to try to get a better motion.
Okay, well, before we move on this, is there a seconder for the motion as is? Okay, so Member Rabbits, no seconder for your motion. So, Member Van Passen, did you want to add further?
Could I indulge the Mayor of Haldeman to maybe comment on my suggestion that there's three distinct items here?
Mayor Hewitt?
Well, thank you, Councilman Passon. I think you're correct. I think what's in front of you is a challenge, because none of us are equipped with the ability to predict the future, as Dr. Schenker has made out. But you're about to put $5 million on the tax levy between Haldeman and Norfolk in the next 3 years and commit to hiring 32 people without knowing for certain whether we're going to need them or not. And I guess your assertion in that the current path we're on is not sustainable for the staff to continue to manage the hours that's been required of them. And so there is a number. What that number looks like is somewhere between where they're at today and the 32 they're proposing in this report. We as council, and I know that today you're the Board of Health, but as also council, we all have that fiduciary responsibility to manage that purse and be able to report back to the public that that decisions that are financially impacting those individuals are decisions made with the best available information we have. And with no disrespect to Marlene and her team, because I know she's been scrambling to get this together, I truly just can't support the ask for 32 FTEs today on a temporary basis to 2022 without more information. And I think that's where our councils come from. So I think it's coming up with that strategy of what that number looks like. And then, as you mentioned, and Councillor Rabbits mentioned with respect to cost recovery, it's difficult today for you to support the current recommendation because you don't know what the cost recovery looks like, because we don't know what that number is going to be to offset that $5 million in total. So I'd like to see what that is, whether it's $500,000, whether it's $1 million, what's the number? So what are we supporting and how many FTEs if it's not going to be 32? And that's why I'm hoping that we can get some more information. And as I say, I don't want to be the person to stumble that process, but I think we need that information. And in this particular case, I'm here having this discussion with you because of the significant impact it has on Haldeman. This isn't just a Norfolk decision, and I realize our circumstances are that the Board of Health, you being the Board of Health making that decision, but this decision, this vote you're making today is a 3% hit to our tax levy, and I can't sit by and obviously allow that to happen without having some input, and I'm glad that we're able to do that, and hopefully we can get somewhere in the middle here. Thank you.
Mayor Hewitt, could you comment, just as Councillor Van Passen asked, so if we looked at it as three distinct issues today, one, the individuals to make up for, the 4 to 6 for the overtime and so on, the records portion, and obviously we know your feeling on the significant hiring. Can't hear you. You're on mute still. No, still. Is there an audio issue perhaps?
There, am I on mute?
There you go.
Is that better?
Yeah, it's better.
Okay, it's odd. Maybe because I have a MacBook, it works backwards. It says it's mute on my screen, but it must be unmuted. So anyways, I think that, if you went down a path that provided some relief for Marlene and her team, and allowed us the opportunity, or allowed our staffs the opportunity to flush out some of the other questions, such as the cost recovery, such as, how many FTEs and whether it is to the extent of 2022 or whether it's maybe for a shorter period. I think that would be amenable to Haldeman County, and it could be brought back to our council for us to pull that deferral and then pass a motion that follows in line and consistent with yourselves that supports you. But as it sits today, the current recommendation was one that we weren't able to support this morning.
And anything specifically on the records portion of that? I guess that's what I'm getting at.
Well, the question was asked from Haldeman County, the same with respect to the records portion. If it's a requirement that the social services has brought up, and it's something that we need, and for the reasons that Marlene brought up before, why it wasn't pursued in the past. Again, I think that our staff as well as council can support moving forward on it. If it's going to improve our services and bring efficiencies, we're always about that. So that wasn't really the stumbling block for us. It was the support of 32 FTEs.
I guess one of my concerns with the record portion is just, we're still looking at a reduction of health units, are we not? I mean, obviously things have been slowed down with Ford government throughout this process, but they're still looking at reducing the number of regional units. So does that sort of not lead back to your comments earlier that,
Yeah, so Madam Chair, it's our understanding that that's still be on the agenda. We haven't had dialogue probably since February or March on the restructuring modernization. We have no reason to believe that it's not going to continue once the pandemic is over or settled down.
So when we look at this bringing efficiencies, what's the payback period? If we're saying it's for the equivalent of 4 employees, what's the payback period over, adopting this if we're looking at a regional or, a restructuring of the health units prior to that payback period being accomplished even?
Yeah, so if I may, the one thing that we did do when we were looking at sole sourcing this is that we actually did a survey across the province to see which EMR the province was using across the different across the different health units. And the one that was primarily used, including Toronto, which is, I know, different in many aspects. Once Toronto implements something, it's something that typically would be utilized. So we have selected a particular platform that would be used ideally probably with any form of regionalization. And to speak specifically to your inquiry about efficiencies, there is a several-year payback for that to gain efficiencies overall just in the clinical documentation piece of it outside of COVID.
Sorry, just to augment my colleague's answer, the large issue with the electronic records retention at this point in time is a risk mitigation effort. The challenge is if we do have a COVID outbreak within our health unit currently, because we are forcing people in, or not for, because they don't have access to electronic records management and it's all manual files, and because the security around the manual files, they have to be in the office to access those files. So it increases the exposure to if there is an outbreak, it would limit the functionality of that unit because you would expose more people in the health unit to being exposed to potentially multiple weeks off. And during that time period, they can't work from home or they can't work remotely. So that's, a big challenge, a big part of the ERM function here is to provide the ability for remote work to public health, which they don't have at this point in time, which we view as a risk mitigation factor with outbreaks, or even if you don't have an outbreak, we're having challenges right now, frankly, with staff because of childcare or school issues where their son or daughter is in a school and their bubble is told that they have to stay at home for a period of time, then they can't come in to work and they can't access the records, and therefore, even though they're not actually sick, they can't actually be productive at that point in time. So, the payback period on the software, I wouldn't be the primary focus at this point in time. It's more a risk mitigation strategy at this point in time.
Well, to that though, Jason, at the same time, if it's hiring additional staff that you had able to do the same function, that's why I ask about the payback period. Right, there has to be an element of, yes, you could hire additional staff that's going to be less than that capital outlay if it's, not going to be
Sure,
for forever. I mean, I understand the risk mitigation piece, but there's other ways to mitigate risk besides just an outlay of capital for a piece of software that may be redundant to the county in a year's time.
Sure, and it's the cost of the risk too. So, and just to be clear, the $400,000 is just the cost of the software. You would also have soft time costs involved into actually getting the system up and running. So if it's the challenge with this is if you're looking at a potential payback period in a very condensed period of time, if we think public health is going away, that business case might be a lot more difficult. If public health doesn't go away, and you have the ability to, as this council will see under Project Domos that's coming up, we have the ability to move people to work from home and reduce fixed overhead costs. That's the other advantage in the long term. But if it's a short-term payback period, I don't think the business case is there on that dollar and cents type of comeback. The other challenge with hiring more people is the reality of the job market and the reality of where we are as a preferred employer. We don't have an easy ability to hire more nurses in Norfolk County or more public health inspectors just because the pool is only so large. So if one of the risk mitigation strategies is to hire more, that might be a challenging strategy to execute.
So you need a nurse for records management?
Well, you would need a nurse to actually be able to do the work that the records management is there for. The records management is patient records, so it's the ability for nurses to actually access the patient's records to then do their job. And so it's the ability for, and, it's the ability to share those records. So if I have a manual chart, and, and I'm not a nurse, I don't even play one on TV, but if I chart the issues and the health records and I put that in a file, another nurse has to come and access that. Where if it's an electronic record, it's on the network and multiple nurses then can access it. You don't actually have to have access to the physical file. So it is nurses that would be interacting with those charts, and I assume also PHIs and some other limited people in that area. But I'll let Marlene answer that.
So understanding that the Ford government is still likely to do this restructuring, and there was big concerns at the beginning of us obviously being, amalgamated with Hamilton, and losing that rural component. I remember the desire was that we would, ideally be amalgamated with Brant County and be able to, another municipality that has, similar conditions and so on, issues that we have here. Have you guys, would one option not be to approach Brant and see if they would be able to, for a fee, bring on our records management with them, which maybe would lend, additional, I guess, support, for when the province does make that restructuring decision that, hey, we're already working closely with Brant now, and it would maybe give us an advantage towards securing that amalgamation as opposed to one that we don't want?
So a couple of things. I know Brant does use the platform that we're recommending, and we have a purchasing team, and I don't want to speak for purchasing, but we have been working on a cooperative purchasing initiative with the City of Toronto to assist facilitate some of those costs. So that doesn't answer your question specifically, Board Member Chop. However, it is something that we did consider when we selected this particular platform.
And sorry, just to add on to it, the largest cost is the licensing cost, and that's an annual cost. And whether, and that's a seat type of license cost. So whether you move to, on the amalgamation, you would still end up with those costs. And you would still end up with the cost of actually putting your records into electronic format either way. So, the only cost at that point in time is the $400,000. The other issue is I'm not sure where they are with, how they plan to de-evolve or re-evolve or restructure this. But sometimes when you have those types of arrangements, there's minimum requirements prior to the merge, and that might be, you have to have your records on an electronic basis. And so those are the things to consider. But, at the end of the day, the rationale for the inclusion of this item was more around getting us through the next, 18 to 24 months with some risk mitigation on being able to have more flexible work environment going forward.
So just to provide some color as to my big hesitation with this right now is it was maybe 2 weeks or 3 weeks ago that you and I, Jason, had a conversation about the financial system that we just issued debt for that was purchased 10 years ago and has now just been completed. And I remember you commenting to me how you were shocked that it was a sole source back in 2010 for a piece of financial software that ultimately wasn't, exactly what we needed. So why, what's behind then the sole source on this? Just because it's the same software as Brant's using? Like, what's the argument then for tackling this way?
Through the chair to the chair, I think the difference is one is you're going with a best in breed that's been adopted by a number of the health units in Ontario, and there is a piggyback clause that's embedded in that. I don't know the full history of the way Norfolk County acquired the previous financial system, but but I wouldn't point to that it was a best in breed or adopted by the vast majority of the municipalities. It's not a financial system that, that you could point to and say, yeah, the vast majority of municipalities out there have that financial system. The other thing is when you look at the other health units who have acquired this system, they have gone through a competitive process, and they're institutions with strong procurement policies such as Toronto, so that that they've already gone through that procurement process and testing to obtain it. So that's why they allow the piggyback clause onto it. You generally can't do a piggyback clause unless you've had a competitive procurement that underlies it. So I think that would be the biggest difference. Do we like to, do you like to sole source and do you like to acquire systems in this manner? No, would be my, would be my comment. But I'm not sure how a competitive process might lead us to a different decision than the other health units went through. So the ability to move quickly with a piggyback is the advantage in this case.
And that's fair enough. It just, the question becomes, it's challenging to say, without that justification for the sole source, now you've provided it. I think it just goes to Mayor Hewitt's point about, what's in the report, because 10 years ago when staff came forward, they would have done so, I'm assuming, in the same way, recommended a sole source, and, without council asking for that justification, they went ahead with it. So I just think that it's important for some justification to be laid out there for moving ahead in this way. Councillor Van Passen.
Thank you, Madam Chair. I'm prepared to put a motion on the floor to deal with part one of my dilemmas, which basically would be the second part of the recommendation that the Board of Health authorize an increase of up to 8 temporary FTE until June 2022 to continue with the response to the COVID-19 while reopening mandated public health programs and services with an estimated annual cost of $544,000. And added to that would be the last two parts of the recommendation, that the letter be sent to the Minister of Health requesting 100% funding, and that the Board of Health send a letter to the Minister of Health and Ministry of Agriculture and Food to help with the isolation period. So if I could put that motion on the floor and get a seconder for that, I think that would solve one of my dilemmas. You want it read in entirety?
Thank you, Madam Chair. If this will solve one of Councillor Van Passen's dilemmas, I'd be more than happy to second it.
That the Board of Health authorize an increase of up to 8 temporary full-time equivalent until June 2022 to continue in the response of COVID-19 while reopening mandated public health programs and services with an estimated annual cost of $544,000. And that a letter be sent to the Minister of Health to request 100% funding of the costs of COVID-19 response that exceed the 2020 annual service plan and budget. And further, that the Board of Health send a letter to the Ministry of Health and the Ontario Ministry of Agriculture, Food and Rural Affairs and Service Canada to advocate for funding and policy changes to support the agricultural community during the self-isolation period and to provide policy for post-isolation to manage COVID-19.
Okay, that's been seconded by Member Michelli. Further discussion? Member Columbus?
Yes, I'd like to ask the General Manager of Health and Social Services, she's looking for 30.2 positions, and this is 8. What kind of impact, how are you going to handle that scenario?
So through the chair, our full complement for providing mandatory programs is 80. So 8 is a small subset of that, and we need about 40 to provide the COVID team. So I would have to come back to the board and advise of programs that we will not be able to continue, that we would have to not continue or provide moving forward.
Not provide in what area moving forward? What would you eliminate, I guess is what I'm...
We would have to look at all the programs and reduce it probably by the 40 FTE, so probably close to 40 to 50% of the mandated programs. So I think I would need to come back to the board with what those programs would be so that you're aware of what the decision was that the board was making.
Mayor Hewitt, I saw you wanted to chime in there. Obviously, you won't have voting rights, but
Sorry, and again, it's a tough one for all of you, especially as, you know, being on the board and making the determination, and it's playing a shell game between which program's more important than the others, and I'd say none of them are more important. That being said, it does come down to the purse again, and I truly am convinced that when push comes to shove, and we're faced with having to move dollars from one envelope to another, and not be able to provide 100% of one particular mandatory program, such as you know, healthy babies or smoking cessation or what have you. I don't believe in the center of the hurricane of COVID that the Ford government's going to penalize us or refuse the potential funding that those funds were required for in different programs. And I can't say that for certain, obviously, but I think it would be a very difficult challenge for the government to determine that we're not worthy of that funding for this particular year because we needed that staff for a different resource or purpose.
Member Roberts.
Thank you. Through you, I was just going to propose a friendly amendment. I don't think we were actually receiving staff's report as information. So if we want to get through the business today, we should probably at least accept the report.
Thank you, Chair. I was just wondering if Board Member Van Passen would take a friendly amendment, be interested to just quantify that those 8 positions would be public health positions, not admin or IT positions. So if we could quantify that they would be public health positions.
Go ahead.
Sorry, just so staff can gain clarity on the motion. I believe Member Van Passen put a dollar amount, an upward budget amount. I believe he said $545,000. If that's the case, a public health nurse fully burdened cost to the payroll is slightly over $100,000. So if it's 545 divided by 8, it's about $68,000. I'm not sure how we would do that. Additionally, I believe Member Van Passen's motion is to alleviate some of the overtime issues. I'm not sure how 8 was derived, but I would suggest maybe 8.2 because the 0.2 that's in the chart relates to the medical officer of health topping him up to a full-time position. As currently and throughout this whole pandemic, our medical officer of health, though he has worked far more than full-time hours, is actually not compensated as a full-time member. So I would just like to gain clarity on those 2 points.
If I may, Madam Chair, being a simpleton I am, in the report it says that 4 full-time equivalents is 272 annually. So when I said 8, I just doubled the 272 that was in the report. So, but yes, the TAO is speaking. If they are specifically for the health positions, then yes, they are more expensive, and I'd be more than happy to adjust that number according to the CAO's advice and according to Councillor Huffman, that they are specific. That was my intent, that they can specifically take over the duties of our other medical sort of staff, but I'm assuming that as long as we give approval for the full-time equivalent positions, that the manager will hire and whatever staff are required, because it could be that you need 7 medical and 1 backup or whatever, but I would leave that to staff if that's, you know, we're just going to approve the number of positions and how much it's going to, an upset limit on how much it should cost, and leave it to staff to manage the day-to-day of that.
Am I missing, is something here? Because would that not number even with the nurses, would that not have been prorated between now and January?
We apologize. Staff is just trying to figure out how we can practically deal with the amendment with a budgetary amount. So I'm wondering if it's going to go through, if we could have
Like,
a few minutes.
I also understand the position with Shanker. I mean, there is nobody that has worked harder and longer and so on, but just in the interest of transparency in the report, like, I also wasn't really picking up on that, to be honest with you, which is a fair point, and it is something that we need to address. I think this just goes to Mayor Hewitt's point, which was why Haldeman was asking for a deferral for some more of this detailed information to be laid out in there before we made such a significant move. I feel that I'm learning some information that's not even necessarily come forward.
Yeah, through the chair, I think staff would always like to be able to put the information in more fulsomely and earlier. I think the challenge, as you're seeing, is you have several departments that are operating beyond maximum at this point in time, and therefore, this report alone, when you look at the underlying data that was provided, had to be drilled down to that level, is probably easily a couple hundred of hours of total time to dig up the data. So I don't disagree. It would be better to have that information, quicker and for a longer time to absorb it. But staff is working kind of at kind of all-out pace to deal with the issues. So we do apologize for that, but it is a symptom of why we're asking for more resources, because we're not operating at normal levels at this point in time.
Member Hoffman.
Thank you, Chair Chop. I'm feeling that slippery slope of policy on the fly that we've used that term before, and I would like to move for a deferral.
Okay, is there a seconder? Member Columbus. And deferral takes precedence, so let's take a vote on the deferral. All those in favor? And that's carried. Opposed? Okay, thank you, Mayor Hewitt, for joining us. Did you have something else? Okay, I didn't know if you had something else to add there. Moving on, I guess then, go ahead, Member Van Passen.
Thank you, Madam Chair. The deferral, I take it, just referred to the motion that was on the floor, but we should still receive this report as information and direct staff to gather that extra information that we're looking for. We can't just walk away from it and ignore it, so.
Fair enough. I mean, I assume to a degree it was understood from Haldeman's motion that they were going to come back and provide some additional, but if you want to put that down for the record, by all means.
Well, I think that we should ask staff to come back with some more details on sort of splitting that request into the separate parts, and also based on Haldeman's request on a bit more information on the needs, the wants, and the possibilities, and your questions about the electronic medical records thing, that I think staff is well aware of the questions that were asked, because we've been at it for over an hour. So if we could receive the report's information and ask for staff for more information as per the request made during the meeting of October 6th.
Okay, a seconder for that? Member Michelli, any further discussion? Go ahead, Member Columbus.
Yes, Madam Chair, and I know the subject of cost recovery came up, and as the Ag Advisory Board representative for council here, I just wanted to make it straight, setting straight that we did pass 4 motions over time. And I'll just read them. On May 19th, that the medical officer of health be requested to reevaluate the criteria around the agriculture program in consultation with the ag community. On June the 6th, that the board asked the medical officer of health to consult with staff and members of the Ag Advisory Board to look for practical amendments to the requirements for isolation plans related to Section 22 order. And then on June 19th, therefore be it resolved that the Halton Norfolk Board of Health commits to working side by side with the agriculture community. And on July 7th, that the Board of Health direct the Health Unit to undertake consultation with representatives from the Norfolk County Ag Advisory Board prior to implementing any substantial program or service changes impacting the agriculture community. So the concern I have here is we've got 4 motions, all approved by council here, and there should be consultation with the Ag Advisory Board before implementing this cost recovery program that's been discussed.
Well, I think there's going to be significant financial analysis first to be able to determine what that even looks like.
Right. Councilor Abbott's put a motion on the floor that included that, and that was a concern that I had, and perhaps other members of council, other members of the Board of Health had. Thanks.
Okay, so should we proceed with the Agricultural Advisory Board update, and then we'll go from there on that component?
I'll provide a very brief update. I'm cognizant of the time and where we are in the schedule. There was a Agricultural Advisory Board meeting that both Ms. Miranda and myself attended, along with a number of the board members here. There was a series of, I'll call them FAQs, or asked questions that were submitted to the Board of Health, to the Health Unit. The Health Unit has provided a response to the Agricultural Advisory Board, and we have a meeting on Thursday to further discuss those responses. And to Councillor Columbus's comment, on Thursday, we are also going, since this is all live today, we are going to raise the issue that Haldeman's council had raised, and obviously this council had raised, with regards to cost recovery methodology for those costs. So I'm sure it'll be an interesting agenda on Thursday night.
Thank you, Chair Chop. Without any information in front of me, I can certainly say that I don't support looking at this full cost recovery right now in general, because we're the municipality that's encouraging additional bunkhouses on site, but yet also saying that we're going to, that it would be a requirement due to isolation, but also saying that we would be upping the fees for that. So that'll be an interesting discussion when that comes forward. But I'm hoping for a general update for those Board of Health members and community members that weren't on the call for the Ag Advisory Board, just to bring the general public up to speed, essentially where we are with working with the province with mandated changes and what the ag industry can expect from us as our next steps. I would also be interested in hearing specifically about more about the Lima applications. I believe you said, Ms. Miranda, that that is now mandated as a part of their programming. Are we behind on those? Are we on track? Have they started? I heard a comment about them starting soon, and I don't know typically when they would start. And I'll leave it at that for now. Just a general update, specifically looking at inspections as well.
You're embarrassing. All right. We have written a letter. First of all, we've been in contact with the federal authorities. We have written a letter 2 weeks ago to all 4 ministers. We've asking for the federal authorities to take over the self-isolation plan. We've made that case on 2 levels. One is we think that it would lead to a more uniform standard, and secondly, it would unburden the county on the resources for that. And we also made the point that there's a health equity issue related to providing a proper self-isolation program. That's been followed up with another electronic communication, and I was just on the phone with federal officials this morning We anticipate further federal review, and I anticipate some response in the next 2 weeks or so. We have pressed in our letter and in our communications that this is an urgent matter because, we have workers returning to their home country, but we will be seeing workers start as early as January, but really the peak will be in February or March. So we are hopeful that the federal government will take action on this. And I think it'll be beneficial not only to the people of Haldeman and Norfolk, but it'll also be a signal throughout the country that we have a uniform standard. I also sit on a committee that's sponsored by MAFRA related to housing standards overall, and that relates more to the post-isolation period. So if we want to have constructive resolution to this, because at one level, it's a wonderful thing that we welcome people from overseas and they can use the remittances that they receive for good things. It's a way that they can use those remittances in their home country to pay for school fees and medical treatment and a lot of positive things. I think, though, that when we have this, the residences, that we have to think of what is the level of risk that we would accept for any other resident of the health district. So, and I've said this in other forums as well, the risk has to be concordant with any other person here in Canada. That we can't expect a migrant farm worker to have any greater risk than any other person who would be a worker here in Canada from getting COVID-19. I think that's consistent with health equity and a basic level of fairness and justice. The second issue is how do we operationalize that? If we can accept that the risk should be about the same, then how can we operationalize that? And we've articulated, and I've said from my perspective, that there are really two additional questions from an operational level. What is the residence cohort? Meaning that what group of people can you live together with and share a bathroom and a kitchen? Because if COVID makes it into that residence, then how many people will otherwise get sick? Now, intuitively, our resident cohort is our families, right? It's our families. So I have a household of 5. I have 3 children. My wife and I have 3 children. And if I got sick with COVID, all my members of my household will be self-isolated. So one is, what is our residence cohort? The second issue in the post-isolation period is, what is the workplace cohort? And that is the number of people that if COVID made it into a workplace, how many people will be self-isolated? There are numbers we can use for that. We can use the number of people who might work at a Tim Hortons, or the number of people that work in an average enterprise in our district, or the number of children in a school. There are 25 in the school cohorts. That's the number we have chosen. The third issue, and just to add to that, most farmers do not have migrant farm workers. I think there are 2,000 farms in this district. I think 204 agricultural enterprises have migrant farm workers. And one of the things that, and I have to check the data, but the vast majority have less than 25 workers. So a work cohort of 25 might be a worthwhile thing. So in a long-winded way, what I would say is we are advocating at the federal level. We've already advocated. I was on the phone today with federal officials. We're advocating at a provincial level. I was asked to serve on this territorial provincial committee. They have not yet met. Apparently there's another group that's working on this, and there may be standards promulgated in the near term. But I think that the county, the health district is trying collectively to try to effectuate a positive resolution to this item. I do think that if we can get the federal government to take over the self-isolation period, that will free up a lot of our resources for other activities related to public health, including opioids, which is another item that I think is important. So sorry for that long-winded response, Marlene, but I don't know if that answers the questions on that item.
I think we have some correspondence in our information package as well in a response to Mayor Chop's letter from the federal level that specifically talks about this would fall more directly with the provincial government. So I don't, unless your call was much more positive in an opposite direction today, it seems as though we're not having much luck on that federal level.
If I could just share my thoughts, I remain optimistic that the federal government will act. At least on my call this morning, that was my sense, that the urgency of the situation, I think, at least my sense is that it's acknowledged. So I'm hopeful that the federal government will act on the self-isolation period. I think provincial guidance is also worthwhile. So, you know, as soon as I know more and the health unit knows more, we will definitely share that with members of the Board of Health.
Thank you, Dr. Nesathury. So just in answer to your second question, we are doing inspections, and they're well underway for the Lima applications, and we have prioritized them based on arrival dates. So we're focusing on the January arrival dates, and then we'll go into February and March. And we recognize that the late March and April is when we should have a significant influx of migrant farm workers coming to the jurisdiction. I just wanted to clarify too that inspections are a regular part of the Lima application. The exception was last year because of COVID, that what we did is we reviewed the previous year's inspection, and if there was no compliance issues from that, we approved that, and we moved that forward, ensuring that a water sample was completed, and then we worked on the application submission to support the applications for the Lima. And we also did virtual inspections to bring on additional bunkhouses or trailers that had been used in the past. Anything new, though, we did continue to do new inspections. My point earlier is that moving forward into this growing season, Service Ontario, through farms, has advised the ag community that they will not process a Lima application without the inspections, and that was articulated to the community at large.
Thank you, Madam Chair. Dr. Nesathury, did I hear you indicate that you're in support of a made-in-Canada self-isolation plan versus the past Alderman Norfolk self-isolation plan? I thought that's what you're indicating. So.
Yeah, you know, I would characterize it like this. We support, and we've always advocated for the federal government, and I personally advocated the federal government should manage the self-isolation program. Concordant with that, any self-isolation plan has to advance the safety of the people who are actually participating in that. So my hope is that the federal government, in fact, take over the management of the self-isolation program. And the proposal, and I'm happy to share the letter with the Board of Health, what we had proposed is the same type of, and we've proposed this, we've articulated this even from the very beginning, which is a program like for Canadians who return from China or from cruise ships, that they go to Trenton and the federal government provides the supervision and provides the self-isolation plan and then releases those individuals. And then at that point, and this is part of the health equity issue, is at that point, once the people are released from federal supervision or the federal supervision of the self-isolation plan, they have the same risk as any other person who comes to Canada. One of the distinctions from a health equity point of view we have to at least consider is that migrant farm workers are one of the communities, a few communities that I know of, where the employer manages every part of their residential life, which is different than other people who might come to Canada. And they don't really have a choice in where they self-isolate. That's determined by the owner or the operator of the agricultural enterprise. So I think, as part of public health, the fundamental goal of public health is to advance the health of the community. And if people ultimately were to come and have the same risk in our community, that advances so many things related to equity and equality. And that's what we hope for. The second issue is that part of public health practice is just not the people in our own health district, but how do we effectuate policy throughout the country? And some parts of Canada have more public health resources and some have less. So I do think that's another thing, although it's a subordinate item in my mind, I think it's another item that we should advocate for.
So if we can get a copy of that letter that you're mentioning before the Ag Advisory Board meeting, it'd be appreciated, I think, by the Ag Advisory Board members.
Sure, we can get that.
Thank you.
Member Shelley.
Thank you, Madam Chair. Just for clarification, if all members of the Board of Health could get a copy of that letter, just in case it was only going to the Ag Board members. Thank you.
If I can work this again, of course.
I think, sorry, my question was fairly long-winded. The third part was next steps. What can we expect from the health unit, from the Ag Advisory Board? Is there, I think at the meeting there was discussion about communications going out. So is there a plan developed yet that's comprehensive for the ag community for the 2020, 2021 year? Is that communicated? What are the next steps?
So through the board chair, so we have submitted a formal response to the Ag Committee as requested that it be sent to them, and we have circulated it to the board chair and the members of the board or council that are on that Ag Committee. We have taken all of the questions, and the environmental health team is working on providing revised guidelines to support them in some of the questions that they had, i.e. can barriers be used, how can they be used, what does the 2-meter measurement mean, all of those questions that were asked. And we'll be sharing that with the Ag Committee, or sorry, the Ag Board on Thursday, get their perspective, and hoping to circulate that after that meeting through the environmental health team. There are some other things that Mr. Burgess and I are working on. He's working with building and seeing what resources we can support to expedite some of those building and fire code issues that may arise. And I'm working with the Ontario Health and Province and our local assessment centers. There were some questions around testing and native homes of our migrant farm workers who will require a negative test 72 hours prior. So we're working on those activities, and that's been taken up to the provincial level as well. Not so much about getting the test, but getting the timely response, which is a lot of concern. So that's been taken forward as well. So those are the type of things that we continue to work on, and we're hopeful we'll have at the Ag Board and have some final communication that we can circulate to the whole community, because we too have been getting additional inquiries from the farming enterprises.
Thank you again, Madam Chair. And Marlene, I've had some calls about inspections, and their growers are getting ready for the 2021 season. They're wondering, you know, if they have to put in an extra washroom and petitions and all that, which you've identified in your letter. And some of them have been told that just for a revision of their sewage system, they have to have it it takes 2 weeks. They've got the builders there right now and the plumbers and everything, and it takes 2 weeks to get somebody out there to inspect it. Is there a shortage of building inspectors right now, or what's the issue there?
Through the chair, I'm not sure what the specifics are, but yeah, it's not uncommon that it's a greater than a week turnaround time for building inspection to be scheduled and executed on. You know, especially this time of year, there's lots of builders who are trying to get people into their occupants, so final inspections and all that stuff, and that's why we're looking at you know, that's one of the reasons why we're looking at how we can free up, you know, some resources for this program. But, you know, it is a, you know, it's an extensive drain on, you know, normalized resources to do all this stuff. So, yeah, so I can't comment specifically on whether 2 weeks is good or bad. I can certainly talk to Fritz and our CBO and Brandon Sloan, but that doesn't sound out of the ordinary to me.
So do we have many vacancies in the building inspection department? I guess that's the question.
We have one that that we're interviewing for the deputy CBO, but the deputy CBO, the number of inspections he or she would do wouldn't be as full as time as a full-time building inspector.
Thank you.
Further questions? Okay, in that case, just a housekeeping item earlier was to receive our medical officer's health update. So I could have a mover and seconder. Moved by Counselor Taylor, seconded by Counselor Rabbits. All those in favor? And that's carried. Anything further from the board members?
Chair, I believe there was I
Oh,
thought there was an agenda change for Paula to provide an update.
Sorry,
on
yeah,
the
is she
provincial-
here?
Yeah, she's here. She's just walking in.
I'm sorry, has the question already been asked? Having just walked in, I don't know exactly where we're at.
It was just for an update on the provincial mask bylaw.
All right, so as I imagine most of you are aware, the province chose to finally mandate masks on a province-wide level. And it did so through the Stage 3 business rules when it at the same time also made some amendments to hotspot areas. Those particular amendments don't affect us, but the mask amendments do. So our bylaw, which we have, is set to expire on October 21st, and the province's rules are, in any event, stricter than some of our own. As a result, to the extent that there's a conflict on that level, the more strict rules apply, and they've applied since October 3rd. It is a rule that is like our own mask bylaw aimed at the business owner. It is their responsibility to enforce the wearing of masks in their indoor business settings. It is more restrictive that employees don't have the flexibility under the provincial rule that they do under our own. So if you are in a public area within your business facility, you will have to wear a mask as an employee. And that is true even if you're at 2 meters apart. So the only exemptions for employees will be when they are not in a location that the public is frequenting, and even then they must still be 2 meters apart from any other employees, otherwise they have to wear a mask. There is no reference to face shields. The same exemptions apply basically with some small changes. There's no exemptions to 3 to 5-year-olds who cannot be persuaded to wear a mask. So they are very similar otherwise. Unless somebody has a question for me about anything else in relation to our own versus the provincial one, the basic message is the provincial one is the stricter rule in some ways, and therefore that's the rule we all have to follow.
Go ahead.
Through Chair Chop to Paula, thanks for that update. Is enforcement going to fall on OPP as well as our bylaw, just OPP? What would that look like?
So because this is part of the provincial regime, it is like all other provincial rules, which means both bylaw can enforce and the OPP can enforce it. Our own mask bylaw, we only had bylaw as enforcement, though the OPP did assist us with education.
And this one might be for Mr. Burgess. Will the county have any communications put out concerning this? That might be more of a council-related question because it was a council bylaw, but just articulating the changes between our bylaw and the provincial bylaw and what's now expected concerning mask wearing.
Through the chair to the member, yeah, it's on the hit list for comms. We need it. We need kind of to create that FAQ. And that'll be done with Paula in public health to develop something. So, my guess is probably 10 days or so out, we'll probably put out some more communications on that.
Okay, anything further from the board? Member Huffman.
Thank you, Chair Chop. I just wanted to make a request that we maintain monthly Board of Health meetings. I find it disheartening that we're in the middle of a pandemic, and there was this quite an in-depth report that came forward to us today, and we haven't met since July, and I feel that it's prudent that there be more communication and that we be kept up to date on a more regular basis. So if that could just be kind of on on the radar, that we meet monthly and continue to meet monthly, that would be great. Thank you.
Go ahead, Marlene.
Through the chair, we are planning on an advisory committee with some reports actually in a couple of weeks, and we will be presenting reports on the first Tuesday of November, so we are planning to do that. And given the motion today, I suspect we'll have to have some type of a special meeting to provide the information that's been requested earlier today.
Any further? Just a mover for the confirming bylaw. Councillor Rabbit, seconded by Councillor Geisens. All those in favor? And that's carried, and the Board of Health meeting is adjourned. We'll just take a 10-minute break. We'll come back at, let's say, 5 after 5 to begin the public hearings.
clerk about just adding a small, just for the moment, I'm going to call it a small other business item after the presentations,
Which is?
which is regarding the cutting of the roadside ditches.
Okay, so we can raise that in a discussion point at the end. We won't be able to vote on anything today. It's a public hearings committee.
No, Madam Chair, I think my suggestion will be that I just would like to direct staff about something.
Okay, so moved and seconded. All those in favor? And that's carried. Any declarations of pecuniary interest? Seeing none, I will officially call to order the public meetings held under the Municipal Act, the Planning Act, and County Policy. Please be advised that to preserve your right to appeal to the local planning appeals tribunal, you are required to make comments or provide written submissions prior to the passage of a bylaw.
Is everybody still there? I've got no sound.
Yeah, we're here. We're just opening the meetings.
I just would like to direct staff.
We're here, Charlotte. Can you stop the volume?
Seeing none, I will officially. Okay, for those on the line, could you please put your computers on mute until you're called to speak? Prior to the passage of the bylaw. Is everybody still there? I've got no sound.
I have no sound.
Yeah, we're here. We're just opening the meeting.
I just would like to direct staff.
I still can't hear anything.
Can you stop the volume?
I got nothing.
Yeah, Owen's working on it.
Hi, everyone. Can you hear us now?
Yeah.
I can't hear council.
I can't hear council either.
Yeah, but
I have nothing.
can you speak now? I think they can hear us.
Okay, can you hear us now?
Is anybody there?
I'm here.
I can't hear council. I have nothing.
Okay, so
But I can't hear a word or see what's happening, so.
Somebody forgot to unmute council.
It was all fine for the health board meeting.
can you hear us now?
You can send them a text.
Hello, can you hear us now?
Council?
Yes.
Yes.
I've got no visual though.
Okay, well, you don't necessarily need a visual. We've got a PowerPoint slide that's up for the planning report. So if we could get you to go on mute until you're called to speak when we ask for comments.
Okay, thank you.
Okay, so again, just to repeat, I now officially open the public meetings held under the Municipal Act, the Planning Act, and County Policy. Please be advised that to preserve your right to appeal to the local planning appeals tribunal, you are required to make comments or provide written submissions prior to the passage of a bylaw. It is important to note that no final decisions are being made on these matters today. These meetings are to allow the public to provide initial comments, and further reports will come forward at a future date. First staff report is PD 20-51. This is an application that has been received for draft plan of subdivision approval and to amend the zoning bylaw of Norfolk County 1Z 2014 to permit the construction of a group of townhouse dwellings with 8 units. The purpose of the draft plan of subdivision is to establish freehold lots that will ultimately be tied to a common element condominium. The purpose of the zoning bylaw amendment is to reduce the minimum lot frontage, the minimum lot area, minimum front yard setback, minimum rear yard setback, minimum exterior side yard setback, the minimum setback for a deck to a rear lot line, and to confirm parcels of tied land with frontage on a private condominium road. Seawave Homes Limited and agent IBI Group have put forth the application affecting the lands described as Victoria Street and Austin Crescent in Simcoe. Tricia, is that you that's going to present this report? We have Norfolk County staff.
Fabian Sarah is going to present the report today.
Okay, you can begin.
Thank you. Through you, Madam Chair. The subject lands are approximately half an acre in size and front onto Victoria Street, with a portion of the parcel connected to Austin Crescent in the southeast quadrant of the Simcoe urban area. The lands are currently vacant. The subject lands are surrounded by residential dwellings, including single detached townhouses and semi-detached dwellings to the north, west, and east, as well as industrial uses to the south. The subject lands are designated urban residential in the Norfolk County Official Plan and are zoned urban residential type 4. With a holding provision in the Norfolk County zoning bylaw. There's also a special provision on the subject lands 14.686. The special provision on the subject lands is proposed to be amended to address several law provisions, which includes the reduction of the minimum lot frontage, the minimum lot area, minimum front yard setback, minimum rear yard setback, minimum exterior side yard setback, the minimum setback for a deck to a rear lot line, and to confirm parcels of tied land with the frontage on a private road condominium. Currently, the special provision on the subject property would allow for a 12-unit apartment building. The proposal would also allow for a reduction in the parking location requirement, as well as the minimum rear yard setback. The subject development proposal would allow for a reduction from a 12-unit apartment building to an 8-unit townhouse block. As part of the zoning bylaw amendment application, the applicant is requesting that the holding provision on the subject lands be lifted. Planning staff note that the holding will be maintained until such a time that the applicant has entered into a development agreement. For this application, there was a letter of opposition that was received. The letter that was received after the information report was already completed and thus was not included as part of the appendix. This letter will be attached as an appendix to the following recommendation report for council. To summarize the contents of the letter, the property owners raised concerns regarding the requested amendments to the provisions of the zoning bylaw, the overall size and aesthetics of the proposed project, and raised drainage and runoff concerns surrounding the proposed snow storage area. Planning staff will recognize the comments that were submitted and answer to those comments in the following recommendation report for council consideration. Again, the letter will be included as an appendix that will be attached to the recommendation report. I am happy to answer any questions that you may have. The agent, Mike Crow, is also available on Teams and can assist in answering questions. Thank you.
Questions from the committee? Okay, is a member, Councillor Columbus, sorry.
Yes, thank you, Madam Mayor. First question is, the driveway going into this is 7.3 meters wide. It takes up quite a bit of room on this small lot where 8 residences are to be built. Just wonder, was there any thought about opening up an access onto Austin Crescent and narrowing that 7.3 meter road width there?
Through the chair to the agent, Mike Crow, I'd be happy to answer that question if it's okay for me to do so at this time. I'm not sure if that was for staff or for me, but I'm happy to take that on if it's okay.
Okay, any further questions from the committee for staff before we move on to the representative? Sorry. Mr. Crow, are you there?
Yes, I am.
If you'd like to begin.
So through the chair, yes, we did actually consider that a type of arrangement when our original concept plans did have what we called a through driveway connecting the 2 streets. We were, I think, advised at that time that there was some concern about connecting traffic using it as sort of a cut through. So that was our original preference, and we also did consider reducing the width of the driveway. We thought it was a little wide as well, to give us more room for landscaping buffers and maybe assist with some of our setbacks. So I'll leave it at that. We're open to discussing that point. I think that we would require a modification to the zoning for that driveway width if we wanted to bring it down to say 6 meters, but we're open to that, and we're open to exploring a through connection still as well. But obviously would require some changes to our drawings, right?
Okay.
So was that run by past the planning staff that was working on this report for that option, 6 meters wide and opening
No.
up?
No, through the chair. No, that was some time ago. In my presentation, we'll see that we started this pre-consultation back in 2017. So it would have been around that time that we had those discussions with totally different staff and sort of initial explorations.
Thank you.
Okay, if you'd like to begin your presentation, you'll have 5 minutes.
Okay, thank you. So I'm told I can control my screen, so I'm just going to start here. I wish I was going to truncate this quite quickly because I know it's been a long night, so I'm just going to, I don't want to reiterate too much. So thank you very much, Madam Chair, members of committee, for having me at this virtual public meeting. I appreciate the venue and the ability to make this presentation. My name is Mike Crow, C-R-O-U-G-H. I'm a registered professional planner, associate and senior planner with IBI Group, and I'm the agent on behalf of my client, which is Sea Waves Home Limited. It's a proposed residential development for 291 Victoria Street. It's a vacant site. We're proposing 8 group townhouse dwelling units. The zoning permits residential development, but we require modifications as proposed to enact our proposed plan. As I mentioned, we've been at this for some time. There's been some period of us kind of going back and coming in with revised materials. And if we look at the April 15th, 2020 timeline, we all know kind of what happened there in the world where things changed and we kind of lost a few months just dealing with COVID, but we're back at it. The site context, so here we are on the larger scale, just on the edge of the urban area. We're just west of Ireland Road on Victoria Street. The site does have dual frontages on Austin Crescent and Victoria Street. The key stats are it's about 2.4 hectares. Almost equal amount of frontage on both streets. Again, that's why we kind of looked at the options for potentially having a through drive-through. We have urban residential official plan permissions, which allows the block townhouse dwellings to 50 to 30 units per hectare. The adjacent roads are either local roads or we have the 2 RTO roads to the south west. And the zoning is R4H, exception 14686. So this is the key stats of our proposal. I've just been advised that PowerPoint isn't moving. I don't know how. I'm advancing the slide, but it's telling me it's not advancing on your screens. I'm not sure why that is.
So, sorry, Mike, I still have the power to move the slides, so I've just been moving.
I didn't know that. Okay. Can you go right to slides? Just go right to slide 13 then, please. I thought I was navigating the whole time and that was, the power was given to me.
Hello, Mr. Crow. You should have the options to take control of the presentation on your screen if you are connected through the Teams app. If not, we can advance the slides for you.
Okay. Yeah, I see that. Okay. Perfect. Okay, I apologize. I was blasting through that. So let's get to the key site development stats. So slide 13, 8 group townhouse units, freehold ownership. We talked about how we're going to create that through a plan of subdivision. We get a density of approximately 33 units per hectare. Our maximum building height is 9.7 meters. We have, it's actually 19 parking spaces, not 29, so 19 parking spaces. That's 2 spaces per unit plus a total of 3 visitor, which includes 1 barrier free. We have an amenity space area of 255 meters squared, and we have achieved a minimum landscape lot front yard area of 55%. Then staff went through the zoning, so we have the R4 14686 with the holding symbol, and we require rezoning to permit our proposed layout. This is our draft plan of subdivision. We want to create one C-shaped block, which would be the common element area, which you see kind of wrapping around the top, left, and bottom. And then there would be 8 freehold units, and those units will become parcels of tied land, which then would be connected to a condominium, which would be the common element block. For our site plan, we have the 8 freehold units. The access roadway with the common landscape area and parking will all be in the common element area. We have the visitor parking spaces, 1 garage and 1 driveway per unit. The internal garage size is about 2.4 by 5.96, and our total amenity space is 255 square meters. I don't expect council to read this chart. I just wanted to highlight, for the most part, we do comply with applicable zoning provisions. Where we get into some requested modifications is down here at what we're calling the lot level. So we're creating these parcels of tied land and we're applying zoning to those individual puddles. And so as we do that, the zoning that we're requesting needs to be modified to reflect that specific ownership arrangement. And so then this is our site plan here, and you can see we've got a nice regular layout of 8 townhouse units with their single car garages and driveways. The amenity space would be to your right, which is to the north, and the parking spaces are beside that. We have some snow storage space there as well. The rear yards for these units will be at the bottom of the plan, which would be to the east, and access off of Victoria Street. These are proposed elevations, straightforward, typical residential appearance, very good quality materials, standard residential materials, and I mentioned the 9.7 meter building height. These are the side elevations, so the one on the bottom of the split would be what would be facing Victoria Street, the streetscape, and then be visible from the street. So our key planning rationale statements will contribute to a range and mix of housing options. Built form and density is compatible with the existing neighborhood and the characteristics of the neighborhood. Will occur on lands already designated and zoned for residential uses, and proposed development will have access to existing municipal services. So that's my presentation. I'd be happy to take any questions that committee may have.
Thank you, sir. Questions from the committee? Councillor Rabbits.
Thank you, and through you. A common question in these type of developments is often surrounding where trash receptacle could be located. Is there a dumpster, and can you confirm the location of that, or are we to assume that with the width of the road we're going to have a roadside pickup and there won't be a dumpster with this application?
Through the chair, that's a great question. We're not proposing any dumpsters. We're proposing the ability to do the curbside pickup. So we've identified that the road can accommodate that. We still have to go through a site plan approval process. So we did make a concurrent site plan application, and some of those details we will refine through the site plan application, still active with staff as well.
Thank you, and through you. Did you say that one of the units will be barrier-free? I think I picked that up, but...
Through the chair, I indicated one of the visitor parking spaces would be barrier-free, so we've accommodated 3 surface visitor parking spaces on the north side of the site, and one of those spaces is a barrier-free space.
Okay, thank you.
Okay, it doesn't look like any further questions from the committee at this time, but I'll have you stay on the line, sir. We'll take the speaker, and then if there's any further questions from the committee, they can ask you at that time. So is it Kenny Campbell? Are you available? Is there anybody that wishes to speak to this application that's online? We have one registered speaker. If you are online, you're on mute. There we go. Okay, Kenny, can you hear us now? Is he able to? I don't see that having popped up. Okay, Kenny.
Hello?
Oh, there we go.
You're calling for Kenny Campbell?
Yep. We're all ready for you,
Okay.
sir, so you'll have 5 minutes to make your presentation.
Okay. I'd like to thank Norfolk County Council for the opportunity to address you today. My name is Kenny Campbell. My wife Marilyn and I own one of the adjacent properties to the proposed townhouse development. We are participating to express our concern and objection to the above proposed application for the draft plan approval and site plan of division and zoning amendment to the construction of the townhouse dwellings, 8 residential units at the indicated location. The zoning application amendment is for the property directly adjacent to the rear of our property. We initially received notice of this application on June 6, 2018. Upon receiving the notice of the application, we wrote to express our complete objection to the zoning change application, and we're still of the same opinion and strongly maintain our objection. Neither the applicant, Seawaves Homes Limited, or their agent, IBI Group, are members of the community here in Simcoe or the Norfolk area, and who only have an interest in constructing an oversized investment property. The application is essentially for the applicant and their agent to be absolved from all of Norfolk bylaws governing limits on the maximum building height, minimum lot area, minimum lot frontage, minimum front yard setback, minimum rear yard setback, minimum exterior side yard setback, and minimum setback for a deck to the rear lot line. We have no objection to community growth and development. We are, however, completely against developers from far outside of our community acting with no regard for the neighboring property owners and to adhere to Norfolk County zoning bylaws. Our own bylaws have been drafted and approved and are in place for a reason. If we as a community allow anyone, including those outside our community, to build with
Kenny? Can you hear me? Kenny? I think maybe we'll try to do this old school like we did with the phone, or they called in. Yeah, just, I mean, I could even put a telephone up here to the mic. Mr. Campbell, can you hear us? Okay, there he is again. Mr. Campbell, are you there?
I'm back. I'm sorry about that.
Okay,
Can you hear me now?
We can hear you now.
Okay. Clearly, the applicant and their agent have plans for the above mentioned property to profit from it as an investment property, but to do so it violates our existing bylaws and the spirit for which they were created. These applicants are not good neighbors. They're looking to make a maximum profit possible by cramming oversized. Oh, you there?
We're here.
Thank you. They're looking to cram oversized townhouse complex of 8 single-family dwellings on 4 adjacent lots that were originally planned to accommodate 4 single-family dwellings. Dwellings that could have easily been accommodated without violating or requiring an exemption from 7 or more building placement bylaws. We purchased our lot and constructed our home in Simcoe 11 years ago. The location and lot we chose for our home was after careful consideration of the aesthetics of the surrounding area. If this zoning application is approved, it will allow the construction of these units exceeding the height limit for 2 stories. Such a dwelling destroys the aesthetics of the area, and in particular for the adjacent properties. We certainly would not have chosen this location to build our own home, knowing a townhouse would be built directly adjacent to our property. We strongly object to zoning and construction of any ominous oversized dwelling on the property that would require an amendment to a zoning bylaw governing the maximum height of the residential buildings and 6 other amendments governing the placement of the building on the subject property. The zoning change request for the height of the proposed townhouse complex is so they can construct an approximately 33-foot building height. There are no single-family residential structures in this area of Simcoe as tall as the zoning change would permit for the construction of these townhouse complexes. The proposed building does not suit the aesthetics of the surrounding area. As I outlined in the letter that I submitted, before a decision is made on this application for the zoning amendment, and for perspective, I would invite all council members to visit the Simcoe Carillon Tower on Norfolk Street. Stand at the foot of the tower and look up. The height of the proposed townhouse structure would be approximately equal to the bottom of the clock on the Carillon Tower. Walk across the street from the Carillon Tower and compare that same height with the nearby houses and ask yourself if you would want a townhouse complex of that height and that doesn't even allow for the standard for our community on how close a residential structure can be built from the property line. The proposed wall height would be a wall that Donald Trump would be proud of. Site plan submitted to the county also reveals that a portion of the site property immediately adjacent to our property is the planned snow storage area for the townhouse development. It is the only spot available on the plan to plow and store all the snow from the townhouse access lane, which is greater than 80 meters in length by 7.3 meters wide. This can represent a tremendous volume of snow. We're extremely concerned about the runoff, flooding, and damage to our and the other adjacent properties from the snow melt from the designated snow storage area. CUA's homes should be forced to have the snow removed from the property rather than pile it up and store it to prevent damage to the surrounding properties. It was also mentioned earlier that a through connection from Victoria to Austin Street, Austin Crescent, could be considered. And I just wanted to bring light to the point that laneway that exists now on the property is used as a thoroughfare for a number of people that are taking a shortcut from Victoria through to Austin Crescent. I can only imagine what the traffic would be through a private lane to gain access to the area of Austin Crescent. The application under consideration before you is a request by Seawaves Homes to alleviate them from adhering to 7 critically important zoning bylaws. This is not neighborly, nor is it within the spirit of working with the community. We urge the County of Norfolk to carefully consider our and any other objections brought forward to the application and reject the zoning changes outlined in the application submitted. I'd like to thank you for your opportunity to speak with you today, and I would like to wish you all a happy Thanksgiving.
Thank you, Mr. Campbell, for your comments. Any questions from the committee to Mr. Campbell?
Not at this point.
Thank you, sir.
Thank you.
Is there anything further on behalf of the applicant? Any further questions from the committee for staff? Go ahead.
Madam Mayor, I'm looking at page 5 of 11 of the report. Under maximum building height in that chart, the first spot there says 11 meters, and then it says it's proposed to be 9.8 meters, yet Mr. Campbell is indicating it's higher and they need an amendment. So what is the correct number that should be in that chart? Is it more than 9.8 meters?
Through the chair, the R4 zone allows for a height of 11 meters, and the proposed height is 9.8 meters. The chart is correct. Originally, it was submitted as kind of a catch-all, but it is not required as part of this amendment.
So the height of these buildings will be 9.8 meters?
Through the chair, that is correct. That's what the zoning would allow for.
Okay,
The
so
proposal.
that's about 32 feet. Thank you.
Anything further from the committee? If I could have a mover to close public hearing, Councillor Rabbit, seconded by Councillor Taylor. All those in favor? That's carried. And does somebody wish to move the staff recommendation? Oh, Councillor Rabbit, and seconded by Councillor Taylor. Any further discussion on that? All those in favor? And that's carried. So again, Mr. Campbell, this is just, staff will still be coming back with their final report. This is just taking comments for them to draft that final report before making the recommendation to council. The next item on the agenda is staff report PD 20-52. That's an application that's been received to amend the official plan and zoning bylaw to permit the construction of a new office building and 9 residential units within 2 street townhouse blocks. 1694467 Ontario Inc. and OBB Properties and agent Mary Elder have put forth the application affecting the lands described as 55 First Avenue and 600 Norfolk Street in Simcoe. And if staff would like to present the report.
Thank you. Through the chair. The subject lands are irregular in shape and approximately 1.5 acres in size. The subject lands front onto the west side of Norfolk Street North on the north side of 2nd Avenue West, with frontage also on East Street and 1st Avenue West in the northwest quadrant of Simcoe urban area. The lands contain an existing 2-story office building. Surrounding the subject lands is a trailer storage yard to the north and single detached dwellings to the east, west, and south. In addition, the residential dwellings to the south, there is also a warehouse. There are 2 components to this application. The first is an official plan amendment, and the second component is a zoning bylaw amendment. The purpose of the official plan amendment is to change the commercial designation to urban residential for the northwest portion of the subject lands. The purpose of the zoning bylaw amendment is to remove the special provision 14.604 from that portion and rezone those lands R4 and to permit a 3-meter exterior side yard setback. The zoning amendment also seeks to permit a 6.68 meters rear yard and an interior side yard of 0 meters for the rear deck on Unit 2. Each townhouse will be on a separate lot. On the remaining service commercial zoned portion, the zoning amendment aims to reduce the required 3-meter front yard setback on 2nd Avenue to permit a 1.2-meter front yard setback and to reduce the exterior side yard setback from 3 meters to 2.4 meters. The amendment is also seeking to permit commercial parking a minimum of 1 meter from residentially zoned lands and to permit the existing special provision on the property 14.604 to reduce the amount of office space usable floor area to 724 square meters from the permitted 1,450 square meters. For this application, there were no letters or comments received from members of the public. Any comments that are received will be attached as an appendix in the following recommendation report for council consideration. I am happy to answer any questions that you may have. The agent, Mary Elder, is on Teams as well and can assist in answering any questions. Thank you.
Okay, questions from the committee before we move over to Ms. Elder? Go ahead.
Thank you, Mayor Chop. I just had a couple questions, actually. Is there anything in there regarding a retaining wall?
Through the chair, I'm not aware of any retaining wall.
Okay. And was just wondering if, now this might be better left for Ms. Elder, but the time of year that the traffic study was done, is there a date as to when the traffic study was done?
Through the chair, I believe that's a better question for Mary. I can find the answer for you, but I think Mary would have that answer available.
Okay. Okay, perfect. Thank you.
Anything further from the committee? Ms. Elder, are you available?
Hello there, yes.
Just to remind you of our new 5-minute time limit and if you'd like to begin.
The staff have already covered most of the points I was going to cover today, but I will proceed. I'm just looking for that take control button. I'm not seeing it. Okay. And I can't advance my slides either. All right. This is a new commercial build and infill residential intensification project. The office building, known by all because of its prominent location, was there for more than 30 years. It was demolished in the month of September, so it is now gone. A consent application was approved in 2019 to split the subject lands into two. This official plan amendment and zoning bylaw application is a condition of approval. I wanted to point out some of the points of the application for the reliefs that were asked for, because yes, we do have a house that's very close that fronts on 2nd Avenue, and we have to get a driveway in there as we move over towards Norfolk Street North and the building. And so this is why these exterior side yard setback and front yard setback requests are being made. There are 29 parking spaces in the parking area, but again, to fit it in along with the residences, we need to have a smaller area between the parking spaces and the new residential zone that is coming in. Because this office will be used mostly Monday to Friday, 9 to 5 sort of thing, there really won't be a lot of activity going on in this parking lot during the times when most people would use their rear yards and rear decks. So that's why we're proposing that reduction. As far as the residential, well, this is actually, you're seeing a slide now of what the Morrison Insurance building may look like from the street. And then finally we have an elevation of the residential as the last slide. And that's showing the front and the back of them. So they are 2-story build. Just making sure I've covered all my points here. I wanted to say that there is a retaining wall on the site plan to respond to the question from our councillor, and it is around the existing house that's fronting on 2nd Avenue. There is something there now, but new will be built in order to make sure that that is solid, and there will be privacy fencing as well. As far as the traffic study, it was done in 2019 when we did the consent application. I can't tell you exactly when, but I'm going to say probably August or September would be my guess or estimate as to when the timing was on that. So I'm here for any other questions. I'm excited about this because certainly this location, every time you drive up Norfolk Street North or come south on it, the height of it just after that former overpass is certainly one that everybody notices. So that building was over 30 years old, and it will be nice to see a new building there. That's it for now.
Thanks very much, Mary. Any questions from the committee? Councillor Hoffman, were you? That's good. Okay. In that case, if I could have a mover to close the public hearing, Councillor Rabbit, seconded by Councillor Geisens. All those in favor? That's carried. Does somebody wish to move the staff recommendation? Councillor Taylor, seconded by Councillor Michelli. Any further discussion on that? All those in favor? And that's carried. And our third planning report for the evening is staff report PD 20-57. This is an application that's been received to amend the official plan to redesignate the lands from agricultural to agricultural with site-specific policies to permit tourist recreational facilities, and to rezone the land from agricultural to agricultural with special provisions to permit additional uses, including 70-bed resort facilities with other related uses, and a height allowance of a 3-story building. IBI Group, on behalf of McKeel Properties Limited, have put forth the application affecting the lands described as Part Lot 22, Concession 1, Geographic Township of Charlottesville, Norfolk County. And staff would like to present their report.
Good afternoon. Thank you, Madam Mayor. The project is called Victory Hall. The development proposals for a 70-bed resort facilities with a series of tourist recreational activities.
Mohammed, are you able to? Okay.
So, Madam Chair, the subject site is located along Front Road between Fisher's Glen Drive and Chilean Road, approximately 4 kilometers southwest of Port Royal. The total land area is 20 hectares and it has a 225-meter frontage along Front Road.
The land is generally flat and heavily vegetated with coniferous trees with a steep slope at the south side of Lake Erie. The surrounding land use is predominantly agricultural with some resource-based recreational and educational facilities within the proximity. So, Madam Chair, to the Council, the development proposal consists of a single building with 2 wings with a total 70 beds overnight accommodation, a restaurant, meeting rooms, and an assembly area. The outside recreation area includes walking trail, outdoor pool, and a rooftop terrace. Few additional uses such as limited retail facilities are also proposed to cover a wide range of tourist commercial uses. A total of 158 parking spaces are provided, including 6 accessible parking spaces, which are located at the north side of the building. So, Madam Chair, because of the complexity of this project, we requested for a number of technical reports, including an agricultural impact study, which primarily address land use conflict between agricultural and non-agricultural uses. Other reports include a traffic impact study, a scoped environmental impact study, functional servicing report, and water and sewage feasibility study. A planning justification report was submitted in support of the development. Apart from the technical review and policy analysis, the planning justification report identified potential positive outcomes such as new employment opportunities, opportunities for conservation of natural features, benefit of tourist recreational facilities in the lakeshore policy area, and collaboration with local vendors. So, Madam Chair, the application is requested in non-agricultural use in an agricultural land. Both provincial and municipal policies generally require the preservation of agricultural uses and also provide some criteria for limited non-agricultural uses in agricultural lands. Although we'll review the proposal through a lens of every applicable policies, I want to highlight some of the key PS provincial policy statement and official plan criteria that allows a limited high agricultural, non-agricultural use in an agricultural land. And these criteria include the non-agricultural use cannot be in a specialty crop area. The new development must comply with minimum separation distance formula provided by the Ministry of Agriculture. There is an identified need, there should have an identified need of the proposed use in the planning horizon, and alternate locations must be evaluated first. In that case, for non-agricultural use, the first priority will be an attempt to see if there is any opportunity to provide that development outside the agricultural land. If it is not feasible, then the proposed development has to be in a low priority agricultural land. We'll also provide a conformity check through these policies in our recommendation report. The subject land is also within the lakeshore policy area secondary plan. The secondary plan encourages this kind of development as a secondary use in an agricultural land, but also allow some limited and small scale uses of non-agricultural use in an agricultural land. The size and extent of the post-development will be examined through the lens of these policies. So, Madam Chair, we received staff and agency comments on this application. The county staff reviewed the scoped environmental study. The report indicates the presence of species at risk and significant wild habitats, including migratory birds in the subject land. More clarity is required about the scale of impact on the natural resources and how the impact will be mitigated and restored. The land has a steep slope at the south side of Lake Erie, and an erosion control plan will be required to satisfy the technical review of the county. LPRC and county staff identified that the proposed building footprint is encroaching the hazard lands, and county staff does not support any such development on hazard lands. The new BPS 2020 allows on-site sewer and water service with certain criteria, and a Ministry of Environmental approval will be required for this. On a positive side, tourist and economic development suggested that there is a dire need of alternate overnight accommodations, and this is consistent with county's strategic priority. Madam Chair, a significant amount of comments are received from the member of the community, and this is mostly in opposed to this development. If we categorize these comments, these include land use conflict, impact of traffic increase on existing road infrastructure, including public safety, potential damage to ecology and increase of noise in that area. There's a great concern about the compatibility of the proposed land use. This is a small community, and a resort facility like this is considered as a major transformation to many of the community members. This will impact on the road capacity, pedestrian and cyclist safety, ecology and natural features and habitats. There is also a great concern about the erosion of the top of the bank and on lake area. So, Madam Chair, in planning staff's opinion, there are some key issues to be resolved and more information are necessary for further review. And this includes the traffic impact study that did not provide any information on active transportation and pedestrian safety. There is a blind hill condition from eastern side to the access of the property and will require a third-party review of the traffic impact study. The building footprint is partially on hazard land. Further coordination will be required between the applicant, PHC, and the county. We'll also perform a detailed conformity check through the lens of various policies for the recommendation report. We'll also need to know how much area would be impacted by the development footprint, including trails and outdoor recreational facilities, and what would be the restoration plan. And we also need an erosion control plan to understand what would be the approach from perspective of public safety along the lake area. That's everything from me. I'd be happy to answer any questions. Thank you.
Is that the end of your presentation, Fabian? Or Mohammed, sorry?
Madam Mayor, that's the end of the presentation. I'd be happy to answer any questions.
Perfect, thank you, sir. Questions from the committee? Go ahead, Councillor Van Passen.
Thank you, Madam Mayor. I got to frame this as a question, right? Did a lot of work when I was the chair of the Ag Advisory Board with the downturn in the tobacco industry 10, 15 years ago to get sort of adjustments to the official plan and the zoning amendments to allow for other uses in the agricultural zone. And that was changed in the last official plan, but everything was based on small scale on farm as an accessory use to the farm. And I just don't see how this one fits as a small scale use accessory to the farm in an agricultural zone.
It's an issue. Through Madam Chair to the Council, this is an issue we are actually looking at this moment. Yeah, it is true that through the official plan and the lecture policy, lecture area secondary plan, that actually allows smaller scale non-agricultural uses. And particularly in the lecture policy area, it also mentions that this kind of development can have not more than 8 accommodation unit, overnight accommodation unit. So in this case, we are looking at that in several perspectives, including how it is actually confirming from site-specific perspective, as well as the overall broader context.
I think your battery, they all seem to be dying today for some reason. Owen's going to bring you one here, just one second. Councillor Van Passen, just hang on one second.
There. Just to follow up on that, though, the previous official plan did allow for developments like this as part of the Lakeshore secondary plan, but they were to be directed to the urban areas, specifically Port Dover and Port Rowan, and they would be in the urban area or adjacent to it. And I think the upgrade in the new official plan is in close proximity. And again, I don't see where this is in close proximity to an urban area, considering the closest urban area is Port Dover or Port Rowan. So again, I'm just not sure how this fits as the intent of the official plan and the provincial policy statements.
So, Madam Chair, to the council, thank you for these comments, and we'll take back this and we'll look after that. The official plan still says that generally the tourist vacation facilities like that should be towards the more urban areas, but it has some options also. It provided some options to have some smaller scale developments along the policy area. That's what the policy says.
So Columbus.
Yes, Madam Mayor, I had a similar thought about that, and I'm just looking at page 3 of 21 of the report, where it says at the bottom, the Lakeshore Policy Area of the official plan provides direction on county strategy to address potential additional uses on prime agricultural land within the designated lakeshore area. The LSPA, Lakeshore Policy Area, encourages agro-based tourism. And resource-based tourism is a secondary low-priority agricultural area in there. And similar to Councillor Van Passen, a 70-unit hotel complex, I don't see it fitting. I don't see it being compatible with the neighborhood whatsoever. And I recall years ago this was discussed at the Ag Advisory Board when we actually looked into that lakeshore policy area and put that into effect. And that was the indication that it had to be geared towards an agricultural enterprise, the development like a winery or that type of thing, not an independent, non-agricultural operation is what's proposed here. This proposal here would actually fit perfectly at the former Gamble shipyards, is the way I see it. Thank you.
Further questions from the committee? I think that comment was perhaps a bit offside. John, are you with us?
Yes, Madam Mayor, I'm here. Thank you.
If you'd like to begin, sir.
Thank you, members of council, ladies and gentlemen. John Arians from the IBI Group. I'm here on behalf of Breakwater Investments. With me is Rati Hayter. She's a planner with IBI as well, and together we have a PowerPoint presentation that we'd like to share. We're aware of your 5-minute time limit. Unfortunately, we weren't aware of it when we made the PowerPoint, but we will speed through this as quickly as we can. Your staff have provided a good overview of the location of the property and the fact that, you know, it is on the lakeshore between Fisher's Glen and Port Ryerson. They've described the area, approximately 50 acres and about 700 feet of frontage. And what is being requested is an official plan amendment to add a site-specific policy to permit a country inn on this property. And we've asked for a 70-suite accommodation together with spa, restaurant, meeting rooms, and the other outdoor facilities. The project has been modeled after Langdon Hall in the city of Cambridge, and I hope you're familiar with this site. It's a very high-end, upscale country inn situated in a rural area where there are no municipal services on county roads. Langdon Hall in Cambridge has 60 guest suites. And the reason we asked for 70, quite frankly, is based on a marketing analysis. Generally speaking, weddings, conferences, seminars have a guest list of about 130 to 150 people. And when we anticipate not all of them are going to stay over, but 2 persons per room generally requires 60 to 70 suites, and hence that number has come forward. So it's been modeled after a very high-end luxury estate type of development known as Langdon Hall.
As you can see, majority of the property will remain open space with the existing pine tree plantation, where we have future trail accesses around the plantation, and the building is situated along the lakeshore, so we have panoramic views of Long Point Bay. As you can see, the lot coverage is 3.5%. That's a mistake on the screen. It is 3.5%, and we have 70 suites. We also have 3 stories on the side wings, and we have 152 standard parking spaces.
As staff indicated, a number of technical reports and studies were included to confirm that there really are no technical reasons not to support the application. From an environmental, agricultural, servicing, and transportation standpoint, all of the technical studies support the development. Your planning staff provided a good overview of the policy framework that's in effect, and we look forward to working with them as we continue to fine-tune this application. In our opinion, this application is fully compliant with the provincial direction, and as well the overall direction of your official plan.
As you can see, the subject lands are located along the lakeshore area, which is considered to be a place to provide opportunities first to support tourism. We're requesting an official plan amendment just to cover all of our bases due to the direction to direct small-scale and recreational-related development. We're requesting a site-specific OPA to allow for the following uses.
So to answer Councillor Van Patten's concern, your official plan and the secondary plan does not have a definition of what is small scale, and hence, to be out of an abundance of caution, this official plan amendment has been put forward, so that clearly a 70-suite hotel with a 3.5% lot coverage on 50 acres, in our opinion, does represent a small scale type of development, and it does take advantage of the panoramic views of, the majestic Long Point Bay in this area. Staff identified a number of concerns raised by the members of the public, and we will address them. From a traffic capacity point of view, we obtained up-to-date traffic counts. We looked at the afternoon and morning rush hours, and we counted the numbers of cars. We then added a 2% growth factor, and then our traffic engineers added the cars that would be contributing by the proposed development. As you can see, there is ample road capacity to accommodate this facility. From a traffic safety point of view, we wish everyone would drive the speed limit, because at 80 kilometers an hour, the site distances meet the minimum standards for site safety. When we modeled it at 90 kilometers an hour, the access from the west has a 29-meter deficiency. So the recommendation moving forward would be to either add additional hidden driveway signage or simply move the driveway so that it does fully comply with the setback requirements.
Another issue raised by the public is the loss of active agricultural farmland. As stated before, we are maintaining majority of the pine tree plantation, and forestry is a permitted agricultural use. Furthermore, Schedule B10 does designate the subject lands as low priority agricultural land, as the planner said on the file. Also, we're taking a farm to table approach by supporting the local agricultural industry by using the following local vendors.
So while there might not be an agricultural use on the property other than the forestry use to pine plantation, we do intend to take full advantage of the wonderful farm markets that are available in the Norfolk community, and will utilize their products and services. Oops, I'm going the wrong way here. One of the main considerations of this project are the economic impacts, and particularly the year-round economic impact Most of your tourist commercial facilities are seasonal in nature and they operate for 3 or 4 months. This facility will be open 12 months of the year. It'll result in employment and career opportunities. I mentioned the local businesses, the agricultural businesses that will be supported by this facility, the construction, the jobs, the local material and goods, and of course additional tax revenue that'll be created. We would also point out that there are no infrastructure issues. State-of-the-art sewage treatment plants and water supply facilities will be provided. The disturbance to agricultural is also one of the concerns raised by the residents, and to that effect we prepared an environmental impact study which has been reviewed and supported by the Conservation Authority and your own Forestry Department. And we appreciate that when we go through the site plan process, there will be mitigation required to ensure that habitat is not adversely impacted and that, in fact, enhancements will occur.
Another issue raised by the public is that the proposed development would be in hazard lands. The proposed development will be located outside of the hazard lands. The final building location will be determined based on the stable top bank and in coordination with the LPRCA as well. Another issue raised by the public is compatibility with the surrounding area. Seen from our site plan, the proposed building is buffered by the existing pine tree plantation. It is approximately set back 300 meters from the road, which is around 3 soccer pitches, and 150 meters from the nearest neighbor. If you, the next slide will show that we are compliant with the NDS setbacks. And just in terms of noise, this is an upscale wedding and conference center, so noise impact should not be as much.
So really, when you consider there's about a 600-foot buffer of heavily planted vegetation between us and our nearest neighbor. This is the zoning bylaw amendment that is being requested, and it lists the recreational, tourist, commercial uses envisioned for this property. So to summarize, we feel that the application is consistent with the provincial direction. It's in conformity with your official plan and your Lakeshore secondary plan direction. It's located on lower priority agricultural lands, and it will also support local agricultural vendors and is fully compliant with the separation distances. Existing natural heritage features will be maintained and enhanced, and traffic safety and capacity concerns can easily be addressed. There will be no development on hazard lands, and it will be adequately serviced by water. And I guess my concluding comments are that we feel this is a very desirable application. When we first approached the planning department, this actual project was identified as a green team initiative, and the green team was meant to be for those projects that were in desperate need by the county, particularly for accommodation purposes. And of course, with COVID, the dream or the green team components were not able to materialize. And notwithstanding the significant economic benefits of this project, we look forward to working with staff as we continue to bring this forward, and both Riti and myself are available to answer any questions.
Thanks very much, John. Questions from the committee? All right, thank you, sir. We'll have you stay on the line in case there's any further questions afterwards.
All right, thank you.
Mr. McKeel, are you with us? Oh, sorry, you did have questions.
Yes, I am.
Sorry, Blair, just hang on one sec. I think there are some questions now for John.
Yeah, I did have a question, Madam Mayor. On the proposed amendment, the additional permitted uses, I think there's 16 listed. A hotel is number one, which, by the way, includes bars and nightclubs. But it also includes banquet halls and meeting rooms and a restaurant. And I was wondering why they're specifically asking for both of those as amendments.
Through the chair, we've listed them as permitted uses. They could be considered accessory uses to the hotel. Similarly, the spa, the banquet, the restaurant, the gift shop, these are all accessory uses to the hotel, And again, to be transparent and to clearly identify the full nature of the development, we've listed them here as permissions.
Well, then if I could carry on, that's a good answer for that one, but you're also listing vacation dwellings, marine-related and marine commercial, tent and trailer glamping establishments, and a few other things that I don't even know what they are, but like, is there future plans in addition to what is on this proposal, and that's why you're asking for all of these permitted uses up front?
Again, through the chair, I think what we're trying to strive for, sir, is a degree of flexibility in that, Long Point Eco Adventures is one of my clients in Norfolk County, and their glamping establishments are very successful. And if this resort wanted to include, an area of 5 to 10 pads for glamping, for example, is there really a need to come back and seek a zoning amendment for something that minor? So to provide a degree of flexibility, there is an opportunity for dock along the waterfront. There is an opportunity for a stair climbing system. We have them throughout Muskoka. People could come from boat trips from Port Dover to Victoria Hall, access the terrace and the restaurants, and then return by boat. So we don't exactly know what the future will hold for this facility, but we're very excited about it, and we're simply trying to get a degree of flexibility here.
Okay, further questions? Okay, next, Mr. McKeel, go ahead.
Yeah, first I want to thank everyone for taking the time, and certainly I took the time to read through some of the comments from some of our neighbors, and I respect them as well. I'm not trying to do anything but what I thought was good for the whole community, and that is to create a special place like a Langdon Hall that would create probably 70 to 100 full-time jobs apart from the capital to do this, but in a sustainable way. And I personally would see everything from a farm's market almost as part of this and a bunch of other things. I can't say that it would sustain itself growing produce or corn or something on this property, but I can say that there is a need. And I know nobody likes change, but when you look at the overall Norfolk community, I do think that there's a need for places for people to stay. I think they can be softer and quieter than a Super 8 motel downtown somewhere. And I think that it attracts not just tourism, but creates long-time economic value with very little impact. It seems to me the greatest concern is traffic on Front Road. I live on Front Road. I do have a home there. I have seen the comments about, well, you're moving. I own a number of properties in Norfolk County, and I'm not sure that I'm moving or not, but during this pandemic, I listed a couple of my properties because I do have a number of properties. I like the area there. I see this as an ideal location for something like this. And I also see it as being able to harness everything around it. And that it only, we've got horseback riding and stuff across the road from us. We've got educational stuff with birds and raptors. Just down the road is a bicycle place. I really see this actually bring a lot of added value. I know that's easy for me to say because I'm trying to do this, but that's, if I thought I was doing something really wrong, I wouldn't do it.
Thank you, sir. Any questions from the committee? Thanks, Blair. Moving on, I think the next registered speaker, I just lost my list here now, Colin Brown.
Thank you, Madam Chair. We weren't sure if we were going to have the economic benefits included in the presentation today, so my focus was going to be on the economic benefits. I'm the project manager of the development, and I'm not going to repeat a lot of what John added on his presentation, but the bottom line is with this is we have someone who does want to invest in the community and creating jobs and supporting local businesses, and in these trying times, it's a good thing for the community, and all the studies are backing it, and the environmental side and traffic are things that have really come up front, and we've got a good team here that will really take those comments into how we move forward on this. Thank you.
Thanks, Colin. Any questions from the committee? Catherine Stevenson, I believe you're next. Catherine, are you available? I can't see the other list of 4. She's not there. Okay, Charlotte, I believe I see your name up there.
Okay, I'm here.
All right, Charlotte, you have 5 minutes.
Okay. I had a statement that I spent a few days putting together, and that's all gone to the birds after reading the justification report. I would like to point out to council and make it known publicly that there is an absolute mistruth being stated in the justification report is in fact an out-and-out lie. It can be found on pages 14 and 15 of the justification report, and it regards to the local vendors, saying that local vendors, there were preliminary discussions between the applicant and local vendors prior to the submission of the application for pre-consultation, and multiple local vendors from a variety of disciplines offered their support. Going down the list, I am listed as number 7. I am Ryerson Glen Farm. I did not speak to anyone about offering my horses for use. I do not offer my horses for public use. I have not ever offered my horses for public use, and I will not offer my horses for public use in the future. That is not my business plan. I just would like to think that just the simple fact that that is a gross misstatement and untrue fact, it has to discredit the entire justification report. Moving on in said report, there are a few statements that are absolutely questionable, stating that the nature of this proposal would be compatible with the surrounding land uses. I don't see that there's anything like that in this area, so I don't see how this could be considered compatible. And it also states that this project will not set a precedent. I also beg to differ on that statement. A few years ago, just down the road towards Port Dover, there was a company that tried to have a marina and golf course and all that instated, and their application was denied because they were worried about the precedent being set for the development of the entire shoreline. Further on page 41 of the report, there is a planning comment stating that no removal of any trees from the existing natural heritage features on the property is required to accommodate the proposed development. Well, they don't have to remove any trees because over the last 2 years, they've removed most of the trees, and they are still continuing to excavate and bulldoze back there. On to the traffic report that they said they did, saying that it will not pose a safety hazard or a safety risk. I would like to note that their traffic study was done on March the 4th. This road is not busy between October and April. It's an agricultural area. Farmers are not in their fields that early, and tourists are not in the area this early. So to do a traffic study in March to determine whether or not the overload of traffic from this proposal will affect the traffic on this road is absolutely bogus. The traffic study needs to be done on a sunny day in the middle of summer, preferably on a weekend when the traffic along this road is ridiculously heavy. I would also like to just argue the fact that agriculture to ag special consideration basically means you're rezoning it for commercial use, and that's a very sugar-coated way of putting it. All agricultural land needs to be preserved because according to an article in the OFA on Nation Valley News, the severing of agricultural land for non-farm residential or commercial building lots removes farmland from production forever. The ongoing loss of prime agricultural land in Ontario cannot be ignored. Census data from 1996 to 2016 shows a steady decline in land area. Today, Ontario's farmland represents less than 5% of the province's overall land area. It would certainly paint a contradicting picture for a county whose slogan is the Garden of Ontario to allow farmland to be appropriated for use. Going back to the justification report, in many places, the statement is...
You have 1 minute remaining, Charlotte.
Okay. They state many times in their justification report that the land in question is being underutilized. Having a green space on agricultural land is not underutilizing that land. Green space land is just as vitally important to the county, to the country, as arable farmland is. So to downplay that there are trees and therefore it's not being used is just an absolutely bogus thing to say. In closing, I would just like to take a quote direct from Peter Jeffrey of the OFA. This quote is from a memorandum that he actually wrote on this product, saying that, quote, developments of this scale are better suited to service lands within an urban settlement area, end quote. I just feel that we, the county as a whole, should not let our unique green spaces be gobbled up by large development just for the sake of the mighty dollar. Farmland and green space is disappearing alarmingly fast, and this situation here is a perfect opportunity to curb that trend and show that Norfolk County actually knows enough to value what is truly important. Thank you.
Any questions from the committee for Charlotte? Okay, next speaker is Kim Shippey. Kim, are you available?
Yes, hello. Thank you very much, Madam Mayor. I think everything in which John's report has discussed, as well as Colin, is, of course, all of the comments that I also wanted to speak about today as well, which would, of course, talk about all the value added, as well as all of the reports that have been completed within this particular submission. So everything has been covered for me, but thank you very much for the opportunity.
Thanks, Kim. Next is Lori Witzel. She wasn't okay. So moving on, Phil Forbes.
Yes, Council. I am Phil Forbes, and my wife Janine. We live on the property right at the front. I guess I'm the old guy on the road now. I've lived here for 60 years, and I was actually raised on this property. You know, over and over again, I've tried to think of one particular reason why I wouldn't want a 70-room hotel. Well, I guess again, it's an upscale. And parking lots behind me, but just can't seem to come up with one good reason. I don't know if you could or not, neither, if you lived out here, but I'd also like to say that I'm not opposed to change. I really agree with change, and I just believe that it should be within the urban boundaries, just to stop urban sprawl. We see enough of that going on, that's for sure. I'm also concerned that if they do allow a project like this, to set a precedent, and I believe Chris has talked about that too, but you can't, I don't believe that you should set a precedent to have something like that. And then who knows where we're going to go from there after, if another farmer wants to put something up or whatever. It's we're just basically destroying the green belt, I guess, for financial gain, and everybody wants financial gain, even I do. The traffic, on the other hand, it seems to be quite a hot topic, traffic on this road. This sounds a little funny, but I'm going to talk about Highway 24. And in the last 5 years, Highway 24 has been, as anybody knows, just to cross any one of these roads, get on the highway or cross it, it's really challenging on the long weekends, the regular weekends. So what I believe has happened is a lot of that traffic, or some of the traffic, has moved to the lakeshore just to avoid that. Plus, it's also a great drive to drive down through there. along this road. This road over the years has got more and more cyclists. I'm one of them, actually. There's a lot of walkers and runners that come through here. The runners, I think on the weekends, there's some running clubs and what have you. They do run down through here also. And lots of people walking some from the campground at the Triple C. So there's no bike path here. If there was a bike path on this road, I think it could alleviate a lot of that. It's a shame to put these people in jeopardy by adding extra cars. And I will question the traffic study. Also, I did see snow on the one of the pictures, and March, I believe it was in March. I thought I read earlier. That's probably not a good time to do a traffic study on Front Road. Especially March this year, I think a lot of us were maybe almost told to stay home due to the pandemic. So I don't know if it was quite that early or not. And the other thing in the report, I didn't see anything about motorcycles. I don't know whether they lift motorcycles or not, but I didn't see one listing for motorcycles. And granted, there isn't any motorcycles in March, I don't believe. But there's hundreds in the summer. I can't think of anything else offhand. Can you, my wife?
Well, one of my concerns is, as much as we, Phil and I have actually gotten to know one of the people who's involved with the company that's putting up this, or proposing to put up this 70-room hotel in our backyard with 150 parking spaces. We want to let him and his company know that we really are not opposed to change or progress or even growth, and we know that this community depends on tourism a lot, but we also question the development of this property when these people don't really live here in our community either. And even the residential properties that they do own, they're up for sale. So it doesn't look like they plan on staying here. And we want to let the mayor, Madam Mayor, and the council know that this is our home. This is where we live. Miss Elliott and I think a couple of people who haven't had an opportunity to share, that's why we're here talking to you. For us, it just doesn't make any sense to put a 3-story, 70-room hotel in the backyard of farm property. We live out here because it's peaceful and it's quiet and it's serene, and the entire landscape would be changed by something like this. It makes far more sense for something like this to be in Turkey Point, Port Rowan, or Port Dover. And that's all I have to share.
Thank you very much.
Thank you.
Okay, thanks for joining us. Any questions from the committee? Next is Sandra Maxwell and Hugh MacArthur.
Thank you, Mayor Chop. I would like to reiterate a few of the comments that all have already been made, but I'd like to make them anyway to double their impact, I hope. The front road is a narrow back road with very little shoulders in most places and absolutely no shoulders in others. The road is used by walkers, by bicyclists, by bikers, by bird watchers, and also at certain times of the year with farm machinery. And some of that farm machinery takes off an awful lot of the road. This is not the kind of road that needs an additional 162, according to my count, parking spaces. I was fascinated to hear a comment from one of the IBI people that some of the driveways on this road would have to be moved. And I asked why I should move my driveway so that they can have their hotel, which is supposed to be a country inn, not a hotel. I'm also concerned about the IBI group in general. When I check their website, it says they are urban experts defining the cities of tomorrow. I did not see where it says they are rural experts understanding the complexities of a farming community. I am concerned about this group. They're a city organization. They are not a rural organization. I cannot also find out how this hotel would bring tourists into our area. I would think that any tourists that come into this area and wanted to stay in a place that had great accommodations and a spa and a restaurant up on the terrace and an outdoor swimming pool are going to come anyway. People come to our area to visit the wineries, the apple orchards, the peanut producers, the lavender fields. They don't come here for a spa. They will not bring in more tourists to our area. They will only take tourists away from existing hotels, inns, and B&Bs that are already in the area. Concerning the wildlife in the area, it might be interesting to know that the bank right behind this property used to house approximately 250 pair of bank swallows. Swallow is a bird that is endangered. This year I have been able to count up to 6 pairs of bank swallows, and I don't know why it's gone from 250 to 6, but I wonder why it has gone. I'm also interested in my particular quality of life. My wife and I moved into this area because it was a great wildlife area for us to park in. And we've been here for 35 years, and the wildlife is wonderful. There's a fox in the backyard. Deer walk around in our backyard, sometimes on our front lawn. We've got a possum and raccoons, tons of squirrels. And they all live here, and they all deserve to live here. I'm concerned also about the precedence setting that this business would cause, particularly when I look across the road at a great field of soybeans and wonder how much the man who's growing that is making compared to if he had it rezoned for half a dozen or 12 houses. I think he might be able to make a lot more money that way, but he can't because it's not zoned for that. But he might be interested in trying to get it zoned for that. And finally, I would like to say, please refuse this request. Thank you very much.
Okay, thank you, sir. There's, again, a reminder, there's no decisions being made today. This is a public hearing just to receive comments. It's part of the process on how these things take place. Next, we have Sean and Patricia Fitzgerald.
Mayor, I believe they couldn't attend. They had a medical emergency, so.
Okay, and Sean Collette would be the last one then? Okay, is there anyone else online that wishes to speak that we haven't called upon, or that perhaps we've missed at the beginning? Going once, going twice? Okay, in that case, any further questions from the committee? Councillor Columbus.
Yes, I wonder if we could ask the representative of the IBI group to, it's IBI, is it? Yeah. To address the, in accordance with the Canada Land Inventory, what is the soil classification on the majority of that land?
Through the chair, we retained Sean Colville Environmental Consultants to do the agricultural impact assessment. Mr. Colville has a map in his report which identifies the soil capabilities. I think we're class 3, class 4, and some class 2 lands on the property, but I don't have that report in front of me, sir. I will gladly provide that to you and email it to all members of council.
Yes, I read in the report that it's low priority agriculture, but that's what I was interested in, is what the capability is under the Canada Land Classification System. And also,
Again,
did he take into consideration the fact that there is a lake moderated climate in that particular area where farmers have a longer growing season and can get away with more frost-free days? I didn't see anything in the report addressing that subject.
Again, through the chair, that is something I can bring up with Mr. Colville, and we can certainly bring it back to staff and council's attention.
Thank you.
Further questions from the committee? John, actually, while you're there, maybe you could clear up for the one deputation. They commented on you suggesting they move their driveways. If I'm not mistaken, you were suggesting only moving the driveway for the proposed development.
That's correct, Madam Mayor. If the zoning goes through and we proceed with a site plan application, then, I mean, clearly, we don't want to create a traffic issue with that driveway. And if it means moving it 20 meters or 30 meters, that's not an issue. The other option, of course, is reducing the speed limit and creating some traffic calming measures. We've heard from residents, the cyclists, the walkers, the runners in this particular area. So, some traffic calming measures would be well desired as well.
Thanks, John. And then would you be able to touch on, I doubt you know this information, and our planning staff is new back there, so I don't think they would know either, but is there not a fairly sizable trailer park on Front Road just down the street from there? I believe it was probably approved during Councillor Columbus's time on council.
Yes, Madam Mayor. I think further to the west there is a Bible camp with significant number of seasonal dwellings. It's about maybe 3/4 to a kilometer west of us.
So would you say that was precedent setting? Did many other seasonal campgrounds arrive on the scene?
So as a planning consultant, I very rarely use the precedent argument because each application is unique and sits on its own merits. I didn't present that as a precedent. To me, it's not a precedent. It is there. It's an existing use, and my application has to be considered on its own individual merits.
I agree with you, sir. I just, when I keep hearing the suggestion of precedent setting, over and over as one of the concerns, I understand concerns of residents and not wanting to see that change and so on in their backyards. But at the same time, in terms of using a precedent argument in this case, I would say developers don't generally just flock to municipalities wanting to build Langdon Hall. And I think that it's also dictated by supply and demand. It's not that we just are about to have, 10 new hotels spring up in Norfolk County. Do I think we could really use a beautiful hotel in Norfolk County? Yes, we know that there's a shortage of accommodations. I just wanted to make that point. In terms of this being precedent setting, people, this is, could be a great opportunity for Norfolk County. Instead, we're looking at it as if we approve one, they're going to descend en masse to build other hotels, and I just don't think that's true at all. Any further? Yes, go ahead, sir.
Thank you. We represent the Hilton family of hotels, and I've done a number of Hilton Garden Inns throughout Ontario, and it is a very rigorous process to do a new hotel anywhere. The market demand for hotel accommodations is very difficult to prove so that your financing falls into place. So, will Norfolk County get 10 hotels as a result of this application? I highly doubt that. Again, it's a number of factors that influence this site. It's the location, it's the ambiance, it's the character, it's the rural setting. All of those factors contribute to the success of this project.
I agree. Councillor Van Passen.
Yes, thanks, Madam Mayor. Page 15 of 21 of the planning report, it's page 97 of the agenda. If you look at the very bottom corner of the map, there's an area that's designated open space, the OS zoning. That's the little trailer park. And in defense of Mr. Councillor Columbus, for as long as he's been on Norfolk County Council and Delhi County or Township Council, that was there long before that. It was probably there before both Phil Forbes and I. We've been around there 60 years. It was there before that. So it's been around for a while. But
Fair enough. I had inquired and I was told about 20 years, so it's been longer than that.
It changed hands about 20 years ago.
Roger.
And it changed style a little bit too about 20 years ago. But a follow up to Councillor Columbus's question about the land inventory. I think I see where there used to be a tobacco farm right across the road from that property. They grow ginseng like on the other side of the concession of that property, and that microclimate is very valuable. So I look forward to seeing some more of that report when we discuss this at the next meeting. So hopefully the consultant can bring more detail to us. Thank you.
Any further questions from the committee? Okay, thanks very much, everyone. I guess if I could have a mover to close the public hearing. Moved by Councillor Michelli, seconded by Councillor Taylor. All those in favor? That's carried. And if somebody would wish to move the staff recommendation or propose an alternative, Councillor Taylor, seconded by Councillor Rabbits. Any further discussion on that? All those in favor? And that's carried. Opposed? Councillor Columbus. And I guess moving on now, Councillor Michelli, if you wanted to discuss your grass issue.
Thank you, Madam Chair. This time of year, we get a few complaints from residents about the length or the height of the weeds and the grass along the roadsides in some areas. In fact, our discussion just moments ago with regard to Front Road, I was driving on it yesterday, and the grass and the weeds are very long. And the reason for that is that the county staff is not allowed to cut the roadside weeds until October the 15th. That's been the council policy up to this current year. And the reason for that policy is based on some endangered species of insects that frequent those tall grasses and weeded areas along the side of the road, and that's basically their habitat. But the reality is that the October 15th deadline makes it difficult, of course, for staff to get out there and do the work in reasonably good weather. So there is and because the weather is so important to this work that the county staff do, it's really once a frost has occurred, and we've had a couple or maybe 3 frosts depending on where it is. In fact, it's possible that there hasn't been a frost on that Front Road section because of that microclimate. But we've had enough frost so that those endangered insect species have now migrated south, and so they're no longer there. So it might be helpful for us to be able to tonight to direct staff to alter that policy for at least this year, and perhaps we will, council will see fit at some future date to perhaps adjust that entire policy to base it more on weather results rather than on a specific hard date in a month. So that's what I would like to propose today, that we be able to direct staff to alter that policy for this current year, to allow for the mowing of those roadsides and the roadside ditches. And I'm not clear as to what I would need to do to make that happen.
I think it's a little tough without having Mr. Godby here with us. So,
I'm not a butterfly expert or endangered species expert.
We did speak to Mr. Godby and the roads crew, and they are available to start the process earlier if directed by council. I think the challenge council will have is its specific instruction by council on a particular date for that. Staff is more than willing to undertake the process earlier if council provides direction to staff, and we are in position to, to start the process earlier. It would be, the challenge is we would require specific direction from council because it's already a previous decision of council to pick a particular date, which makes it somewhat cumbersome to make the change now. So that would be that's the challenge right now. Staff is ready to move. It's really up to council.
I believe that was put in place by that darn old council that was here. And I remember the big discussion on it. Huge discussions about this. We had deputations, and it's primarily about the monarch butterfly and the milkweed. Why can't they, when the guy on the mower sees a milkweed plant, why can't he just lift his blade up and keep going? It's as simple as that. Surely to God they must be able to know what a milkweed plant looks like.
Thank you, Madam Mayor. I do, I do believe that this policy was put in by that old council, but I'm not sure that addresses the issue here. We just want to get that part started, even if we do miss a few milkweeds. But having lived out in the country with a lot of milkweeds and really tall grass are really hard to find. I don't think we can distinguish milkweeds from regular grasses. I know the monarch butterflies are gone south. That's a fact because we've had the frosts. I think it would just be. Also, I'm also considering the working conditions of our staff too. When they have to be out there, because this isn't going to get done in a couple of days. After tomorrow, the weather is supposed to be ideal for grass cutting, and I just think if we can get them an extra week head start from the regular start date, that they won't hopefully have to be out there in the first week of November in the cold and possible snow.
I guess the challenge is if there was previous direction from council, so it was, just tell me how you want to handle. I mean, I'm concerned of a complaint by a monarch butterfly enthusiast now being filed that we're going against direction from previous council without this being, but I understand obviously waiting for the council meeting in a couple of weeks makes it.
Thank you, Madam Mayor. I do think also, I mean, the reality is, and I, of course, we can never anticipate what people will do as a reaction to a direction or a decision by any body. But I mean, we are honestly, I realize this is not the end of the world, but today is October the 6th. We're talking about 9 days from now, but 9 days could mean a lot to the people on those tractors. That's all I'm thinking. If I can add, Madam Mayor, I do believe, and I am quite convinced that it is possible to find empirical evidence that the monarch butterflies have gone south.
I'll make a suggestion to council, and it may come back to bite me. We won't be able to mobilize in a day or two, but what I will do is if council's in agreement, I'll have our staff talk to the appropriate authorities, including our arborist, and both internal and external. If the feeling is that the risk is low, we will start our process earlier to maximize the use of good weather to accomplish this. And if we identify any risk areas from any of the authorities out there, then we'll go back to our original October the 15th timeline. And I don't need a motion from council, I'll just do that, and I'll take the heat from the butterfly enthusiast later.
Is everyone in agreement for a show of heads, nods, yes? Okay. So collectively, we'll take the heat together, should this go the wrong way. Anything further? In that case, if I could have a motion to adjourn the Public Hearings Committee meeting at 6:59 PM. Councillor Taylor, seconded by Councillor Geisens. All those in favor? Let's carry. Have a good night, everyone.